Hey Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 200 NCLEX questions and 2 case studies. Without delay, let's get started.
Hannah, a 34-year-old female, presents to the emergency room. Hannah, a 34-year-old female, presents to the emergency room with complaints of ongoing cough, nasal congestion, and myalgia that began about 24 hours ago and is progressively getting worse. She has no significant past medical history and takes no routine medications. Vital signs are temperature 102.5, BP 124/78, heart rate 89, respiration 20, oxygen saturation 96% on room air. Question 1. Select all that apply. To minimize the risk of infection to others, the triage nurse would: A. Provide the patient with tissues to cover the mouth and nose. B. Direct the patient to discard the tissues promptly after use. C. Place the patient before the other patients waiting for treatment. D. Instruct the patient to apply a surgical mask. E. Seat the patient 3 feet away from other patients. F. Educate the patient to wash their hands after contact with secretions. The correct answers are: A. Provide the patient with tissues to cover the mouth and nose. B. Direct the patient to discard the tissues promptly after use. D. Instruct the patient to apply a surgical mask. E. Seat the patient 3 feet away from other patients. And F. Educate the patient to wash their hands after contact with secretions. Rationale: all of the following options would minimize the risk of infection to others except options C. Hannah's symptoms are indicative of influenza, and a rapid flu test is ordered. Question 2. Select all that apply. Signs and symptoms of influenza include: A. Fever. B. Myalgia. C. Non-productive cough. D. Malaise. E. Productive cough. F. Nasal congestion and sore throat. The correct answers are A. Fever, B. Myalgia, C. Non-productive cough, D. Malaise, and F. Nasal congestion and sore throat. Rationale: signs and symptoms of influenza include fever, myalgia, non-productive cough, malaise, nasal congestion, and sore throat. Hannah's nasopharyngeal test is positive for influenza A. She asks about how the flu virus is spread and is concerned about infecting others. Question 3. Select all that apply. Influenza can be contracted by: A. Contact with virus-contaminated blood. B. Contact with virus-contaminated surfaces. C. Close proximity of a virus-infected person who coughs. D. Close proximity of a virus-infected person who sneezes. The correct answers are B. Contact with virus-contaminated surfaces, C. Close proximity of a virus-infected person who coughs, and D. Close proximity of a virus-infected person who sneezes. Rationale: influenza is spread mainly by droplets made when infected people cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. Occasionally, it can be spread when you touch a surface that has the virus on it, then touch your own eyes, nose, or mouth, allowing the virus to enter your body. Hannah will not be admitted and is discharged home on antiviral medication and given instructions on minimizing potential exposure to family members, friends, co-workers, and others. Question 4. What isolation precautions are required for the inpatient or outpatient management of patients with influenza? A. Contact. B. Airborne. C. Droplet. D. Standard. The correct answer is C. Droplet. Rationale: since influenza is mainly spread by droplet precautions are required for the inpatient or outpatient management of patients with influenza. Question 5. Select all that apply. To minimize potential exposure of non-infected individuals to influenza, patient education would include: A. Do not share eating utensils or linens. B. Avoid public places for 48 hours. C. Wear surgical mask while coughing. D. Cover nose and mouth to cough and sneeze. E. Wash hands with soap and water. F. Disinfect all contaminated surfaces. The correct answers are A. Do not share eating utensils or linens. D. Cover nose and mouth to cough and sneeze. E. Wash hands with soap and water. And F. Disinfect all contaminated surfaces. Rationale: influenza-infected patients should not share utensils or linens. To prevent transmission, infected adults should avoid non-infected individuals for 7 days after becoming ill. Surgical masks should be worn at all times to prevent transmission to others in the home, as well as transfer to items.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Hannah is given a prescription for the antiviral Tamiflu and asks the nurse how the medication works. Question 6. Which statement by the nurse demonstrates correct teaching about the antiviral drug Tamiflu? A. It is used to treat, not prevent, influenza. B. It is only active against influenza type A virus. C. It should be started within 48 hours of symptom onset. D. It should never be given to a pregnant patient. The correct answer is C. It should be started within 48 hours of symptom onset. Rationale: Tamiflu is used for the treatment of influenza and the prevention of influenza in those exposed to the virus. Tamiflu is active against influenza type A and type B. Tamiflu provides the greatest clinical benefit when initiated within 48 hours of symptom or illness onset. Tamiflu is the preferred antiviral treatment in pregnancy. The nurse reviews the medical record of a 56-year-old client who was recently admitted to the emergency department. The spouse brought the client into the emergency department after finding a self-deletion note and the weapon cabinet unlocked. Reports that the client is not the same person after being hospitalized 3 months ago with a severe RSV infection and being mechanically ventilated for over 2 weeks. The client states that since being discharged from the hospital, they have periods of heart palpitations, insomnia, apathy, depressed mood, and anorexia. They report that drinking alcohol every night helps to relax, but still becomes anxious and depressed at times. They are very worried about getting RSV again, because the client's sibling, whom the client recently visited, tested positive yesterday. They have nightmares about the hospital experience, because the client nearly died. They lost 35 pounds during the hospital stay, but states they still weigh more than 260 pounds. They were considering self-deletion this evening, because the client was afraid of possibly being reinfected and dying this time. They were recently diagnosed with type 2 diabetes mellitus, controlled by diet and metformin. The social worker interviewed the client and administered several screening assessments for selected mental health conditions. The client admitted to flashbacks about hospitalization and feels guilty about putting their family through that experience. They stated that they were lazy and did not take precautions. As a result, the client developed an RSV infection, which worsened and led to the hospital stay and mechanical ventilation. They expressed remorse for upsetting their spouse and apologized to her and the social worker. Question 1. The client most likely has blank as the primary potentially life-threatening mental health condition, as evidenced by blank and blank. The priority for the client's care is to blank. Options 1. Personality disorder. Dissociative identity disorder. PTSD. Clinical depression. Options 2. Anorexia. Excessive worry. Nightmare. Flashbacks. Options 3. Begin intensive counseling. Ensure personal safety. Start drug therapy. Refer to a spiritual counselor. The correct answers are PTSD, nightmare, flashbacks, and ensure personal safety. Rationale: since surviving that experience, the client developed new emotional and physical behaviors. Two of the classic differentiating behaviors associated with PTSD, and not with other mental health conditions, are nightmares and flashbacks. Excessive worry and anorexia are associated more with anxiety than with PTSD. The client is at risk of self-deletion because the client was planning how to end his life, therefore, the priority for the client's care is safety. Once safety is ensured, the client may start drug therapy, begin counseling, and/or need a spiritual advisor.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 2. The client was diagnosed with PTSD, anxiety, and self-deletion risk. Which physician orders would the nurse anticipate for the client at this time? Select all that apply. A. Begin antidepressant drug therapy. B. Admit to acute psychiatric unit. C. Refer to case manager. D. Refer to spiritual advisor. E. Begin intense psychotherapy. F. Place on self-deletion precautions. G. Limit visitors to immediate family. The correct answers are A. Begin antidepressant drug therapy. B. Admit to acute psychiatric unit. E. Begin intense psychotherapy. F. Place on self-deletion precautions. And G. Limit visitors to immediate family. Rationale: the desired outcome for this client's care is to ensure safety because of potential risk of self-deletion. The orders would be focused on ways to keep the client safe, including admission to the acute psychiatric unit for one-on-one observation and treatment with medication and psychotherapy. Immediate family members could provide support and encouragement for the client during the hospital stay. A case manager would not help ensure immediate safety. A spiritual advisor may be requested by the client but is not usually ordered. Question 3. The client was prescribed sertraline and started on psychotherapy. Select 5 statements that the nurse would include in the health teaching about sertraline. A. This drug is one of the most effective ways to treat PTSD and depression. B. We will be monitoring you for sedation effects while you are here. C. Let me know if you have trouble urinating or having a bowel movement. D. Let me know if you have trouble sleeping or feel nervous while on the drug. E. We will be monitoring you carefully for changes in your vital signs. F. You might experience mild nausea and feel agitated when you start this drug. G. Your liver and kidney function will need to be monitored by lab testing. The correct answers are A. This drug is one of the most effective ways to treat PTSD and depression. D. Let me know if you have trouble sleeping or feel nervous while on the drug. E. We will be monitoring you carefully for changes in your vital signs. F. You might experience mild nausea and feel agitated when you start this drug. And G. Your liver and kidney function will need to be monitored by lab testing. Rationale: sertraline is a selective serotonin reuptake inhibitor that can be very effective in managing clinical depression and/or PTSD. Side effects of the drug include insomnia, nervousness, anxiety, agitation, and mild nausea. This drug can affect liver and kidney function, which should be monitored through frequent lab testing. The nurse would monitor vital signs to help assess for a rare adverse drug reaction called serotonin syndrome. Symptoms include elevated temperature, heart rate and blood pressure, delirium, muscle spasms, and abdominal pain.
The RN is the leader of a team providing care for 6 patients. The team includes the RN, an experienced LPN/LVN/RPN, and a newly educated assistive personnel who is in his 4th week of orientation to the acute care unit. Note to student: use the information from the shift change report below to make brief notes about these 6 patients and refer to the notes as you work through the case study. The patients are as follows. Mr. R., a 75-year-old man who had a left hemisphere stroke 4 days ago. Miss S, an 83-year-old woman with heart disease, a history of myocardial infarction, and mild dementia. Mr. C, a 68-year-old man with unstable angina, who needs reinforcement of teaching for a cardiac catheterization scheduled this morning. Miss J, a 45-year-old woman who had chest pain during the night and is now experiencing chest pain. She is scheduled for a graded exercise test later today. Mr. B, a 93-year-old newly admitted man from a long-term care facility with decreased urine output, altered level of consciousness, and an elevated temperature of 99.5 degrees Fahrenheit. Mr. L, a 59-year-old man with mild shortness of breath and chronic emphysema. Question 2. During the shift change report, the night RN informs the team that Miss S is to be transferred back to her long-term care facility after lunch. What action should be taken for this patient? 1. Instruct the AP to awaken her for vital signs and breakfast. 2. Allow her to sleep for an hour or two while the other patients are assessed. 3. Assign the LPN/LVN to immediately pack up the patient's belongings. 4. Call the nursing home to find out if the transfer can wait until tomorrow. The correct answer is 2. Allow her to sleep for an hour or two while the other patients are assessed. Because Miss S is not scheduled to be transferred until after lunch, it is not urgent to get her ready at this time. Allowing her to rest while the staff takes care of other patients whose needs are more urgent is acceptable. The RN could instruct the AP to keep the patient's breakfast tray and warm it up when she is ready to eat. Question 4. Which patient should the nurse assess first? 1. Mr. C, unstable angina. 2. Miss J, chest pain. 3. Mr. B, decreased urine output and altered level of consciousness. 4. Mr. L, shortness of breath and chronic emphysema. The correct answer is 2. Miss J, chest pain. Although it is important that the nurse see all of these patients, Miss J's assessment takes priority. Her chest pain may indicate coronary artery blockage and acute heart attack. None of the other patients' needs are life-threatening. Question 6. The HCP's prescribed actions for Miss J, who is currently experiencing chest pain, are as follows. Which intervention should be completed first? 1. Administer nitroglycerin 0.6 milligrams sublingually as needed for chest pain. 2. Administer morphine 2 milligrams IV push as needed for chest pain. 3. Check blood pressure and heart rate. 4. Complete lab tests including cardiac markers and daily electrocardiogram. The correct answer is 3. Check blood pressure and heart rate. When the patient experiences chest pain, vital signs should be checked immediately to establish a baseline. Nitroglycerin is usually tried every 5 minutes for 3 doses before morphine to relieve the chest pain. Hypotension is a side effect of nitroglycerin. Blood pressure and heart rate are monitored after each dose of nitroglycerin is administered. When nitroglycerin fails to relieve chest pain, IV morphine is the next action, and the HCP should be notified. Question 8. Which key point would the nurse be sure to include when teaching Mr. C about the post-procedural care for cardiac catheterization? 1. There are no restrictions after the procedure. 2. You will be able to get out of bed within 2 hours after the procedure. 3. You will have to stay almost flat in bed with limited position changes for 4 to 6 hours. 4. Family visitors will be restricted until the next day. The correct answer is 3. You will have to stay almost flat in bed with limited position changes for 4 to 6 hours. Cardiac catheterization is usually accomplished by inserting a large bore needle into the femoral vein or artery. Patients are routinely restricted to bed rest, with the affected extremity kept straight for 4 to 6 hours after the procedure to prevent hemorrhage. Family members are usually permitted to visit as soon as the patient returns to the room. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Question 10. The AP is delegated the task of measuring morning vital signs for all 6 patients. Which finding would the nurse instruct the AP to report immediately? 1. Oral temperature higher than 102 degrees Fahrenheit. 2. Blood pressure higher than 140/80. 3. Heart rate lower than 65 beats per minute. 4. Respiratory rate lower than 18 breaths per minute. The correct answer is 1. Oral temperature higher than 102 degrees Fahrenheit. A temperature elevation to 102 degrees Fahrenheit is likely an indicator of an infectious process. The other criterion parameters are near normal, and assessment or evaluation would instead be based on abnormalities from each patient's baseline. Question 12. The HCP's prescribed interventions for Mr. R, who had a stroke 4 days ago, include assisting the patient with meals. Which staff member would be best to assign this task? 1. Physical therapist. 2. AP. 3. Speech therapist. 4. Occupational therapist. The correct answer is 2. AP. Assisting patients with activities of daily living, such as feeding, is most appropriate to the scope of practice of the AP. The nurse would be sure to instruct the AP to avoid rushing the patient and to report any difficulty with swallowing. Question 14. The AP reports to the nurse that Mr. L, the patient with chronic emphysema, says he is feeling short of breath after walking to the bathroom. What action should the nurse take first? 1. Notify the HCP. 2. Increase oxygen flow to 6 liters per minute via nasal cannula. 3. Assess oxygen saturation by pulse oximetry. 4. Remind the patient to cough and deep breathe. The correct answer is 3. Assess oxygen saturation by pulse oximetry. The nurse should gather more information before notifying the HCP. A pulse oximetry assessment provides information about the patient's gas exchange and oxygenation status. Patients with chronic obstructive pulmonary disease usually receive low-dose oxygen because their stimulus for breathing is a low oxygen level. Coughing and deep breathing help mobilize secretions and can be helpful, but these are not the first priority. Question 16. Which factor does the nurse suspect most likely precipitated Mr. B's elevated temperature? 1. Bladder infection. 2. Increased metabolic rate. 3. Kidney failure. 4. Nosocomial pneumonia. The correct answer is 1. Bladder infection. The patient's temperature elevation indicates an infectious process. For older adult patients, changes in level of consciousness are frequently an early sign of bladder or urinary tract infections. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Question 18. The AP reports that Mr. L's heart rate, which was 86 beats per minute in the morning, is now 98 beats per minute. What would be the most appropriate question for the nurse to ask Mr. L? 1. Have you just returned from the bathroom? 2. Did you recently use your albuterol inhaler? 3. Are you feeling short of breath? 4. How much do you smoke? The correct answer is 2. Did you recently use your albuterol inhaler? A common side effect of beta-adrenergic agonists, such as albuterol, is increased heart rate. Drugs such as albuterol are commonly prescribed for patients with COPD to use as needed to dilate the airways when experiencing shortness of breath. Although the other factors are important and may be related to the patient's COPD, they may not have contributed to the increase in heart rate. Question 20. Mr. C has returned from the cardiac catheterization lab and requires close monitoring after the procedure. Which post-procedural tasks would be best assigned to the LPN-LVN? Select all that apply. 1. Check bilateral pedal pulses every 15 minutes during the first hour. 2. Check right groin area for bleeding every 15 minutes during the first hour. 3. Continue IV fluids normal saline at 50 milliliters per hour. 4. Assist patient to bathroom as needed during first 6 hours after the procedure. 5. Administer morphine sulfate 2 mg IV push as needed for pain. 6. Give patients daily multivitamin and stool softener on return to medical unit. The correct answers are 1. Check bilateral pedal pulses every 15 minutes during the first hour. 2. Check right groin area for bleeding every 15 minutes during the first hour. 3. Continue IV fluids normal saline at 50 milliliters per hour. And 6. Give patients daily multivitamin and stool softener on return to medical unit. The LPN-LVN is experienced, and post-cardiac catheterization care would be familiar to them. Basic assessments, such as checking peripheral pulses, watching for bleeding, and monitoring IV fluid flow, as well as administering oral drugs, are within his or her scope of practice. Most IV drugs are administered by RNs. However, some LPN-LVNs may administer these drugs with additional training. The patient would most likely be on bed rest, keeping the affected extremity straight for 4 to 6 hours after the procedure.
Nitrofurantoin is prescribed for a client with a urinary tract infection. The client contacts the nurse and reports a cough, chills, fever, and difficulty breathing. The nurse should make which interpretation about the client's complaints? A. The client may have contracted the flu. B. The client is experiencing anaphylaxis. C. The client is experiencing expected effects of the medication. D. The client is experiencing a pulmonary reaction requiring cessation of the medication. The correct answer is D. The client is experiencing a pulmonary reaction requiring cessation of the medication. Rationale: nitrofurantoin can induce two kinds of pulmonary reactions, acute and subacute. Acute reactions, which are most common, manifest with dyspnea, chest pain, chills, fever, cough, and alveolar infiltrates. These symptoms resolve 2 to 4 days after discontinuing the medication. Acute pulmonary responses are thought to be hypersensitivity reactions. Subacute reactions are rare and occur during prolonged treatment. Symptoms usually regress over weeks to months following nitrofurantoin withdrawal. Potassium chloride intravenously is prescribed for a client with hypokalemia. Which actions should the nurse take to plan for preparation and administration of the potassium? Select all that apply. A. Obtain an intravenous infusion pump. B. Monitor urine output during administration. C. Prepare the medication for bolus administration. D. Monitor the IV site for signs of infiltration or phlebitis. E. Ensure that the medication is diluted in the appropriate volume of fluid. F. Ensure that the bag is labeled so that it reads the volume of potassium in the solution. The correct answers are A. Obtain an intravenous infusion pump. B. Monitor urine output during administration. D. Monitor the foresight for signs of infiltration or phlebitis. E. Ensure that the medication is diluted in the appropriate volume of fluid. And F. Ensure that the bag is labeled so that it reads the volume of potassium in the solution. Rationale: potassium chloride administered intravenously must always be diluted in IV fluid and infused via an infusion pump. Potassium chloride is never given by bolus. Giving potassium chloride by IV push can result in cardiac arrest. The nurse should ensure that the potassium is diluted in the appropriate amount of diluent or fluid. The IV bag containing the potassium chloride should always be labeled with the volume of potassium it contains. The IV site is monitored closely because potassium chloride is irritating to the veins and there is risk of phlebitis. In addition, the nurse should monitor for infiltration. The nurse monitors urinary output during administration and contacts the healthcare provider if the urinary output is less than 30 ml per hour. The nurse is caring for a client with hypocalcemia. Which patterns would the nurse watch for on the electrocardiogram as a result of this condition? Select all that apply. A. U waves. B. Widened T wave. C. Prominent U wave. D. Prolonged QT interval. E. Prolonged ST segment. The correct answers are D. Prolonged QT interval and E. Prolonged ST segment. Rationale: the normal serum calcium level is 9 to 10.5 milligrams per deciliter. A serum calcium level lower than 9 milligrams per deciliter indicates hypocalcemia. Electrocardiographic changes that occur in a client with hypocalcemia include a prolonged QT interval and prolonged ST segment. A shortened ST segment and a widened T wave occur with hypercalcemia. ST depression and prominent U waves occur with hypokalemia. The nurse notes that a client's arterial blood gas results reveal a pH of 7.50 and a PaCO2 of 30 millimeters of mercury. The nurse monitors the client for which clinical manifestations associated with these ABG results. Select all that apply. A. Nausea. B. Confusion. C. Bradynia. D. Tachycardia. E. Hyperkalemia. F. Lightheadedness. The correct answers are A. Nausea, B. Confusion, D. Tachycardia, and F. Lightheadedness. Rationale: clinical manifestations of respiratory alkalosis include lethargy, lightheadedness, confusion, tachycardia, dysrhythmias related to hypokalemia, nausea, vomiting, epigastric pain, and numbness and tingling of the extremities. Hyperventilation occurs. Hyperkalemia is associated with acidosis. A hospitalized client is started on phenelzyne for the treatment of depression. The nurse should instruct the client that which foods are acceptable to consume while taking this medication. Select all that apply. A. Figs. B. Yogurt. C. Crackers. D. Aged cheese. E. Tossed salad. F. Oatmeal raisin cookies. The correct answer is C. Crackers and E. Tossed salad. Rationale: phenelzyne is a monoamine oxidase inhibitor. The client should avoid ingesting foods that are high in tyramine. Ingestion of these foods could trigger a potentially fatal hypertensive crisis. Foods to avoid include yogurt, aged cheeses, smoked or processed meats, red wines, and fruits such as avocados, raisins, or figs.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client is scheduled for discharge and will be taking phenobarbital for an extended period. The nurse would place highest priority on teaching the client which point that directly relates to client safety. A. Take the medication only with meals. B. Take the medication at the same time each day. C. Use a dose container to help prevent missed doses. D. Avoid drinking alcohol while taking this medication. The correct answer is D. Avoid drinking alcohol while taking this medication. Rationale: phenobarbital is an anticonvulsant and hypnotic agent. The client should avoid taking any other central nervous system depressants, such as alcohol, while taking this medication. The medication may be given without regard to meals. Taking the medication at the same time each day enhances compliance and maintains more stable blood levels of the medication. Using a dose container or pill box may be helpful for some clients. A client's medication sheet contains a prescription for sertraline. To ensure safe administration of the medication, how should the nurse administer the dose? A. On an empty stomach. B. At the same time each evening. C. Evenly spaced around the clock. D. As needed when the client complains of depression. The correct answer is B. At the same time each evening. Rationale: sertraline is classified as an antidepressant. Sertraline generally is administered once every 24 hours. It may be administered in the morning or evening, but evening administration may be preferable because drowsiness is a side effect. The medication may be administered without food, or with food if gastrointestinal distress occurs. Sertraline is not prescribed for use as needed. A client has a prescription to take guaifenesin. The nurse determines that the client understands the proper administration of this medication, if the client states that he or she will perform which action. A. Take an extra dose if fever develops. B. Take the medication with meals only. C. Take the tablet with the full glass of water. D. Decrease the amount of daily fluid intake. The correct answer is C. Take the tablet with a full glass of water. Rationale: why phenicin is an expectorant and should be taken with a full glass of water to decrease the viscosity of secretions. Extra doses should not be taken. The client should contact the healthcare provider if the cough lasts longer than 1 week or is accompanied by fever, rash, sore throat, or persistent headache. Fluids are needed to decrease the viscosity of secretions. The medication does not have to be taken with meals. The nurse teaches a client about the effects of diphenhydramine, which has been prescribed as a cough suppressant. The nurse determines that the client needs further instruction if the client makes which statement. A. I will take the medication on an empty stomach. B. I won't drink alcohol while taking this medication. C. I won't do activities that require mental alertness while taking this medication. D. I will use sugarless gum, candy, or oral rinses to decrease dryness in my mouth. The correct answer is A. I will take the medication on an empty stomach. Rationale: diphenhydramine has several uses, including as an antihistamine, antitussive, antidyskinetic, and sedative hypnotic. Instructions for use include taking with food or milk to decrease gastrointestinal upset, and using oral rinses, sugarless gum, or hard candy to minimize dry mouth. Because the medication causes drowsiness, the client should avoid use of alcohol or central nervous system depressants, operating a car, or engaging in other activities requiring mental awareness during use. Terbutaline is prescribed for a client with bronchitis. The nurse checks the client's medical history for which disorder, in which the medication should be used with caution. A. Osteoarthritis. B. Hypothyroidism. C. Diabetes mellitus. D. Polycystic disease. The correct answer is C. Diabetes mellitus. Rationale: terbutaline is a bronchodilator and is contraindicated in clients with hypersensitivity to sympathomimetics. It should be used with caution in clients with impaired cardiac function, diabetes mellitus, hypertension, hyperthyroidism, or a history of seizures. The medication may increase blood glucose levels. A client who had cardiac surgery 24 hours ago has had a urine output averaging 20 milliliters per hour for 2 hours. The client received a single bolus of 500 milliliters of intravenous fluid. Urine output for the subsequent hour was 25 milliliters. Daily laboratory results indicate that the blood urea nitrogen level is 45 milligrams per deciliter, and the serum creatinine level is 2.2 milligrams per deciliter. The nurse would anticipate that the client is at risk for which problem? A. Hypovolemia. B. Acute kidney injury. C. Glomerulonephritis. D. Urinary tract infection. The correct answer is B. Acute kidney injury. Rationale: the client who undergoes cardiac surgery is at risk for renal injury from poor perfusion, hemolysis, low cardiac output, or vasopressor medication therapy. Renal injury is signaled by decreased urine output and increased blood urea nitrogen and creatinine levels. Normal reference levels are BUN, 10 through 20 milligrams per deciliter, and creatinine, male, 0.6 through 1.2 milligrams per deciliter, and female 0.5 through 1.1 milligrams per deciliter. The client may need medications to increase renal perfusion and possibly could need peritoneal dialysis or hemodialysis. No data in the question indicate the presence of hypovolemia, glomerulonephritis, or urinary tract infection. A client's electrocardiogram strip shows atrial and ventricular rates of 110 beats per minute. The PR interval is 0.14 seconds, the QRS complex measures 0.08 seconds, and the PP and RR intervals are regular. How should the nurse correctly interpret this rhythm? A. Sinus tachycardia. B. Sinus bradycardia. C. Sinus dysrhythmia. D. Normal sinus rhythm. The correct answer is A. Sinus tachycardia. Rationale: sinus tachycardia has the characteristics of normal sinus rhythm, including a regular PP interval and normal width PR and QRS intervals. The rate is the differentiating factor. In sinus tachycardia, the atrial and ventricular rates are greater than 100 beats per minute. The nurse is evaluating a client's response to cardioversion. Which assessment would be the priority? A. Blood pressure. B. Status of airway. C. Oxygen flow rate. D. Level of consciousness. The correct answer is B. Status of airway. Rationale: nursing responsibilities after cardioversion include maintenance of a patent airway first, and then oxygen administration, assessment of vital signs and level of consciousness, and dysrhythmia detection. The nurse is reviewing an electrocardiogram rhythm strip. The P waves and QRS complexes are regular. The PR interval is 0.16 seconds and QRS complexes measure 0.06 seconds. The overall heart rate is 64 beats per minute. Which action should the nurse take? A. Check vital signs. B. Check laboratory test results. C. Notify the healthcare provider. D. Continue to monitor for any rhythm change. The correct answer is D. Continue to monitor for any rhythm change. Rationale: normal sinus rhythm is defined as a regular rhythm, with an overall rate of 60 to 100 beats per minute. The PR and QRS measurements are normal, measuring between 0.12 and 0.20 seconds and 0.04 and 0.10 seconds, respectively. There are no irregularities in this rhythm currently, so there is no immediate need to check vital signs, or laboratory results, or to notify the healthcare provider. Therefore, the nurse would continue to monitor the client for any rhythm change. The nurse is caring for a client with chronic back pain. Codeine has been prescribed for the client. Specific to this medication, which intervention should the nurse include in the plan of care while the client is taking this medication? A. Monitor radial pulse. B. Monitor bowel activity. C. Monitor apical heart rate. D. Monitor peripheral pulses. The correct answer is B. Monitor bowel activity. Rationale: while the client is taking codeine, the nurse would monitor vital signs and assess for hypotension. The nurse also should increase fluid intake, palpate the bladder for urinary retention, auscultate bowel sounds, and monitor the pattern of daily bowel activity and stool consistency, because the medication causes constipation. The nurse should monitor respiratory status and initiate deep breathing and coughing exercises. In addition, the nurse monitors the effectiveness of the pain medication.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The client arrives at the emergency department, complaining of back spasms. The client states, "I have been taking 2 to 3 aspirin every 4 hours for the last week, and it hasn't helped my back." Since acetylsalicylic acid intoxication is suspected, the nurse should assess the client for which manifestation? A. Tinnitus. B. Diarrhea. C. Constipation. D. Photosensitivity. The correct answer is A. Tinnitus. Rationale: mild intoxication with acetylsalicylic acid is called salicylism and is experienced commonly when the daily dosage is higher than 4 grams. Tinnitus is the most frequent effect noted with intoxication. Hyperventilation may occur because salicylate stimulates the respiratory center. Fever may occur because salicylate interferes with the metabolic pathways, coupling oxygen consumption and heat production. Meperidine has been prescribed for a client to treat pain. Which side and adverse effects should the nurse monitor for? Select all that apply. A. Diarrhea. B. Tremors. C. Drowsiness. D. Hypotension. E. Urinary frequency. F. Increased respiratory rate. The correct answers are B. Tremors, C. Drowsiness, and D. Hypotension. Rationale: meperidine is an opioid analgesic. Side and adverse effects include respiratory depression, drowsiness, hypotension, constipation, urinary retention, nausea, vomiting, and tremors. The home health nurse visits a client who is taking phenytoin for control of seizures. During the assessment, the nurse notes that the client is taking birth control pills. Which information should the nurse include in the teaching plan? A. Pregnancy must be avoided while taking phenytoin. B. The client may stop the medication if it is causing severe gastrointestinal effects. C. There is the potential of decreased effectiveness of birth control pills while taking phenytoin. D. There is the increased risk of thrombophlebitis while taking phenytoin and birth control pills together. The correct answer is C. There is the potential of decreased effectiveness of birth control pills while taking phenytoin. Rationale: phenytoin enhances the rate of estrogen metabolism, which can decrease the effectiveness of some birth control pills. Pregnancy does not need to be avoided while taking phenytoin, however, because phenytoin may cause some risk to the fetus. Consultation with the healthcare provider should be done if pregnancy is considered. Telling a client that there is an increased risk of thrombophlebitis is incorrect and inappropriate and could cause anxiety in the client. A client should not be instructed to stop anti-seizure medication. The nurse is teaching the client about his prescribed prednisone. Which statement, if made by the client, indicates that further teaching is necessary? A. I can take aspirin or my antihistamine if I need it. B. I need to take the medication every day at the same time. C. I need to avoid coffee, tea, cola, and chocolate in my diet. D. If I gain more than 5 pounds a week, I will call my healthcare provider. The correct answer is A. I can take aspirin or my antihistamine if I need it. Rationale: aspirin and other over-the-counter medications should not be taken unless the client consults with the HCP. The client needs to take the medication at the same time every day and should be instructed not to stop the medication. A slight weight gain as a result of an improved appetite is expected, however, after the dosage is stabilized, a weight gain of 5 pounds or more weekly should be reported to the HCP. Caffeine-containing foods and fluids need to be avoided because they may contribute to steroid ulcer development. A client is taking Humulin NPH insulin and regular insulin every morning. The nurse should provide which instructions to the client? Select all that apply. A. Hypoglycemia may be experienced before dinner time. B. The insulin dose should be decreased if illness occurs. C. The insulin should be administered at room temperature. D. Withdraw the insulin from the pre-filled pen into an insulin syringe to prepare for administration. F. The insulin vial needs to be shaken vigorously to break up the precipitates. E. The NPH insulin should be drawn into the syringe first, then the regular insulin. The correct answers are A. Hypoglycemia may be experienced before dinner time, and C. The insulin should be administered at room temperature. Rationale: Humulin NPH is an intermediate-acting insulin. The onset of action is 60 to 120 minutes, it peaks in 6 to 14 hours, and its duration of action is 16 to 24 hours. Regular insulin is a short-acting insulin. Depending on the type, the onset of action is 30 to 60 minutes, it peaks in 1 to 5 hours, and its duration is 6 to 10 hours. Hypoglycemic reactions most likely occur during peak time. Insulin should be at room temperature when administered. Clients may need their insulin dosages increased during times of illness. Insulin vials should never be shaken vigorously. Regular insulin is always drawn up before NPH. The nurse is providing discharge teaching for a client newly diagnosed with type 2 diabetes mellitus, who has been prescribed metformin. Which client statement indicates the need for further teaching? A. It is okay if I skip meals now and then. B. I need to constantly watch for signs of low blood sugar. C. I need to let my healthcare provider know if I get unusually tired. D. I will be sure to not drink alcohol while on this medication. The correct answer is B. I need to constantly watch for signs of low blood sugar. Rationale: metformin is classified as a biguanide and is the most commonly used medication for type 2 diabetes mellitus initially. It is also often used as a preventive medication for those at high risk for developing diabetes mellitus. When used alone, metformin lowers the blood sugar after meal intake as well as fasting blood glucose levels. Metformin does not stimulate insulin release and therefore poses little risk for hypoglycemia. For this reason, metformin is well suited for clients who skip meals. Unusual somnolence, as well as hyperventilation, myalgia, and malaise, are early signs of lactic acidosis, a toxic effect associated with metformin. If any of these signs or symptoms occur, the client should inform the health care provider immediately. The home care nurse visits a client who recently got diagnosed with diabetes mellitus, who is taking Humulin NPH insulin daily. The client asks the nurse how to store the unopened vials of insulin. The nurse should tell the client to take which action? A. Freeze the insulin. B. Refrigerate the insulin. C. Store the insulin in a dark, dry place. D. Keep the insulin at room temperature. The correct answer is B. Refrigerate the insulin. Rationale: insulin in unopened vials should be stored under refrigeration until needed. Vials should not be frozen. When stored unopened under refrigeration, insulin can be used up to the expiration date on the vial. A client with a peptic ulcer is diagnosed with a Helicobacter pylori infection. The nurse is reinforcing teaching for the client about the medications prescribed, including clarithromycin, esomeprazole, and amoxicillin. Which statement by the client indicates the best understanding of the medication regimen? A. My ulcer will heal because these medications will kill the bacteria. B. These medications are only taken when I have pain from my ulcer. C. The medications will kill the bacteria and stop the acid production. D. These medications will coat the ulcer and decrease the acid production in my stomach. The correct answer is C. The medications will kill the bacteria and stop the acid production. Rationale: triple therapy for Helicobacter pylori infection usually includes 2 antibacterial drugs and a proton pump inhibitor. Clarithromycin and amoxicillin are antibacterial drugs. Esomeprazole is a proton pump inhibitor. These medications will kill the bacteria and decrease acid production. A postoperative client requests medication for flatulence. Which medication from the following PRN list should the nurse administer to this client? A. Ondansetron. B. Simethicone. C. Acetaminophen. D. Magnesium hydroxide. The correct answer is B. Simethicone. Rationale: simethicone is an anti-flatulent used in the relief of pain caused by excessive gas in the gastrointestinal tract. Ondansetron is used to treat postoperative nausea and vomiting. Acetaminophen is a non-opioid analgesic. Magnesium hydroxide is an antacid and laxative. The client has been taking omeprazole for 4 weeks. The nurse evaluates that the client is receiving an optimal intended effect of the medication if the client reports the absence of which symptom? A. Diarrhea. B. Heartburn. C. Flatulence. D. Constipation. The correct answer is B. Heartburn. Rationale: omeprazole is a proton pump inhibitor classified as an anti-ulcer agent. The intended effect of the medication is relief of pain from gastric irritation, often called heartburn by clients. An older client recently has been taking cimetidine. The nurse should monitor the client for which most frequent central nervous system side effect of this medication. A. Tremors. B. Dizziness. C. Confusion. D. Hallucinations. The correct answer is C. Confusion. Rationale: cimetidine is a histamine 2 receptor antagonist. Older clients are especially susceptible to the central nervous system side effects of cimetidine. The most frequent of these is confusion. Less common central nervous system side effects include headache, dizziness, drowsiness, and hallucinations. A client with Crohn's disease is scheduled to receive an infusion of infliximab. The nurse assisting in caring for the client should take which action to monitor the effectiveness of treatment? A. Monitoring the leukocyte count for 2 days after the infusion. B. Checking the frequency and consistency of bowel movements. C. Checking serum liver enzyme levels before and after the infusion. D. Carrying out a hematest on gastric fluids after the infusion is completed. The correct answer is B. Checking the frequency and consistency of bowel movements. Rationale: the principal manifestations of Crohn's disease are diarrhea and abdominal pain. Infliximab is an immunomodulator that reduces the degree of inflammation in the colon, thereby reducing the diarrhea. The nurse is caring for a client who begins to experience seizure activity while in bed. Which action by the nurse would be contraindicated? A. Restrain the client's limbs. B. Loosen restrictive clothing. C. Remove the pillow and raise the padded side rails. D. Position the client to the side, if possible, with head flexed forward. The correct answer is A. Restrain the client's limbs. Rationale: nursing actions during a seizure include providing privacy, loosening restrictive clothing, removing the pillow, and raising the padded side rails in bed, and placing the client on one side, with the head flexed forward, if possible, to allow the tongue to fall forward and facilitate drainage. The limbs are never restrained, because the strong muscle contractions could cause the client harm. If the client is not in bed when seizure activity begins, the nurse lowers the client to the floor, if possible, protects the head against injury, and moves furniture that may injure the client. The nurse is caring for a client with an intracranial aneurysm who was previously alert. Which finding should be an early indication that the level of consciousness is deteriorating? A. Drowsiness. B. Clear speech. C. Ptosis of the left eyelid. D. Frequent spontaneous speech. The correct answer is A. Drowsiness. Rationale: early changes in level of consciousness relate to orientation, alertness, and verbal responsiveness. Less frequent speech, slight slurring of speech, and mild drowsiness are early signs of decreasing LOC. Ptosis of the eyelid is due to pressure on and dysfunction of cranial nerve 3 and does not relate to LOC. The client with spinal cord injury suddenly experiences an episode of autonomic dysreflexia. After checking vital signs, which immediate action should the nurse take? A. Raise the head of the bed and remove the noxious stimulus. B. Lower the head of the bed and remove the noxious stimulus. C. Lower the head of the bed and administer an antihypertensive agent. D. Remove the noxious stimulus and administer an antihypertensive agent. The correct answer is A. Raise the head of the bed and remove the noxious stimulus. Rationale: key nursing actions are to sit the client up in bed, remove the noxious stimulus, and bring the blood pressure under control, with antihypertensive medication per protocol. The nurse can also clearly label the client's chart, identifying the risk for autonomic dysreflexia. Client and family should be taught to recognize and later manage the signs and symptoms of this syndrome.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is caring for the client who has suffered spinal cord injury. The nurse further monitors the client for signs of autonomic dysreflexia and suspects this complication if which sign/symptom is noted. A. Sudden tachycardia. B. Pallor of the face and neck. C. Severe, throbbing headache. D. Severe and sudden hypotension. The correct answer is C. Severe, throbbing headache. Rationale: the client with spinal cord injury above the level of T7 is at risk for autonomic dysreflexia. It is characterized by a severe, throbbing headache, flushing of the face and neck, bradycardia, and sudden severe hypertension. Other signs include nasal stuffiness, blurred vision, nausea, and sweating. It is a life-threatening syndrome, triggered by a noxious stimulus below the level of the injury. The client with a cervical spine injury has Crutchfield tongs applied in the emergency department. The nurse should perform which essential action when caring for this client? A. Providing a standard bed frame. B. Removing the weights to reposition the client. C. Removing the weights if the client is uncomfortable. D. Comparing the amount of prescribed weights with the amount in use. The correct answer is D. Comparing the amount of prescribed weights with the amount in use. Rationale: Crutchfield tongs are applied after drilling holes in the client's skull under local anesthesia. Weights are attached to the tongs, which exert pulling pressure on the longitudinal axis of the cervical spine. The nurse ensures that weights hang freely and that the amount of weight matches the current prescription. The client with Crutchfield tongs is placed on a striker frame or rotorest bed. The nurse does not remove the weights to administer care or change the level of tension or traction based on client comfort level. The nurse suspects that the client has a pulmonary embolism. Which is the most important nursing action? A. Monitor the vital signs. B. Elevate the head of the bed. C. Increase the intravenous flow rate. D. Administer oxygen by face mask as prescribed. The correct answer is D. Administer oxygen by face mask as prescribed. Rationale: because pulmonary circulation is compromised in the presence of an embolus, cardiorespiratory support is initiated by oxygen administration. Options A and B may be components of the plan of care, but they are not the most important actions. The nurse would not increase the intravenous rate without a prescription from the health care provider. A woman in active labor has contractions every 2 to 3 minutes that last for 45 seconds. The fetal heart rate between contractions is 100 beats per minute. On the basis of these findings, which is the priority nursing action? A. Monitor the maternal vital signs. B. Notify the health care provider immediately. C. Continue monitoring labor and the fetal heart rate. D. Encourage relaxation and breathing techniques between contractions. The correct answer is B. Notify the health care provider immediately. Rationale: fetal bradycardia between contractions may indicate the need for immediate medical management. The nurse would immediately contact the health care provider. Options A, C, and D will delay necessary and immediate interventions. A mother calls a neighborhood nurse and tells the nurse that her 3-year-old child has just ingested liquid furniture polish. Which action should the nurse instruct the mother to take first? A. Induce vomiting. B. Call an ambulance. C. Call the poison control center. D. Bring the child to the emergency department. The correct answer is C. Call the poison control center. Rationale: if a poisoning occurs, the poison control center should be contacted immediately. Vomiting should not be induced without instructions to do so if the victim is unconscious or the substance ingested is a strong corrosive or petroleum product. Bringing the child to the emergency department or calling an ambulance would not be the initial action because this would delay treatment. The poison control center may advise the mother to bring the child to the emergency department. If this is the case, the mother should call an ambulance. The nurse observes an outburst by a client with a history of schizophrenia, during which the client uses extreme foul language. Which appropriate documentation should the nurse make for this occurrence? A. Document that the client is swearing loudly. B. Document that the client is having an outburst. C. Use quotation marks placing dashes and lines in the place of the profane words. D. Use quotation marks, exact words, and additional objective information about effect and nonverbal behavior. The correct answer is D. Use quotation marks, exact words, and additional objective information about effect and nonverbal behavior. Rationale: Option D provides accurate, legally defensible information regarding the client's behavior. Options A and B are not objective. Option C is incomplete documentation and is not legally defensible. A nursing student is planning care for a client with paraplegia who is at risk for injury because of spasticity of his leg muscles. The nurse intervenes if the student plans to include which intervention to minimize the risk of injury to the client. A. Use of padded restraints to immobilize the limb. B. Performing range of motion to the affected limbs. C. Removing potentially harmful objects near the spastic limbs. D. Use of as needed prescriptions for muscle relaxants such as baclofen. The correct answer is A. Use of padded restraints to immobilize the limb. Rationale: Range of motion exercises are beneficial in stretching muscles, which may diminish spasticity. Removing potentially harmful objects is an important safety measure. Use of muscle relaxants also is indicated if the spasms cause discomfort to the client or pose a risk to the client's safety. Use of limb restraints will not alleviate spasticity and could harm the client. The nurse employed in a long-term care facility calls the healthcare provider regarding a new medication prescription because the dose prescribed is higher than the recommended dosage. The nurse is unable to locate the HCP and the medication is due to be administered. Which action should the nurse take? A. Contact the nursing supervisor. B. Administer the dose prescribed. C. Hold the medication until the HCP can be contacted. D. Administer the recommended dose but continue to locate the HCP. The correct answer is A. Contact the nursing supervisor. Rationale: If the HCP writes a prescription that requires clarification, it is the nurse's responsibility to contact the HCP for clarification. If there is no resolution regarding the prescription, because the HCP cannot be located, or because the prescription remains as it was written after talking with the HCP, the nurse should then contact the nurse manager or supervisor for further clarification as to what the next step should be. Under no circumstances should the nurse proceed to carry out the prescription until clarification has been obtained. The nurse is applying a topical corticosteroid to a client with eczema. The nurse should monitor for the potential for increased systemic absorption of the medication if the medication is being applied to which body area? A. Back. B. Axilla. C. Soles of the feet. D. Palms of the hands. The correct answer is B. Axilla. Rationale: Topical corticosteroids can be absorbed into the systemic circulation. Absorption is higher from regions where the skin is especially permeable and lower from regions in which permeability is poor. The burn client is receiving treatments of topical mefenide acetate to the site of injury. The nurse monitors the client knowing that, which indicates a systemic effect has occurred. A. Hyperventilation. B. Elevated blood pressure. C. Local pain at the burn site. D. Local rash at the burn site. The correct answer is A. Hyperventilation. Rationale: Mefenide acetate is a carbonic anhydrase inhibitor and can suppress renal excretion of acid, thereby causing acidosis. Clients receiving this treatment should be monitored for signs of an acid-base imbalance. If this occurs, the medication should be discontinued for 1 to 2 days. Options C and D describe local rather than systemic effects. An elevated blood pressure may be expected from the pain that occurs with a burn injury. Salicylic acid is prescribed for a client with a diagnosis of psoriasis. The nurse monitors the client knowing that, which would indicate the presence of systemic toxicity from this medication. A. Tinnitus. B. Diarrhea. C. Constipation. D. Decreased respirations. The correct answer is A. Tinnitus. Rationale: salicylic acid is absorbed readily through the skin, and systemic toxicity can result. Symptoms include tinnitus, dizziness, hyperpnea, and psychological disturbances. Constipation and diarrhea are not associated with salicylism. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low roughage diet. Which food would have to be eliminated from this client's diet? A. Roasted chicken. B. Noodles. C. Cooked broccoli. D. Custard. The correct answer is C. Cooked broccoli. Rationale: the client with diverticulitis should avoid eating foods that are gas-forming and that increase abdominal discomfort, such as cooked broccoli. Foods such as those listed in answers A, B, and D are allowed. The nurse is working in the emergency room when a client arrives with severe burns of the left arm, hands, face, and neck. Which action should receive priority? A. Starting an IV. B. Applying oxygen. C. Obtaining blood gases. D. Medicating the client for pain. The correct answer is B. Applying oxygen. Rationale: the client with burns to the neck needs airway assessment and supplemental oxygen, so applying oxygen is the priority. The next action should be to start an IV and medicate for pain, making answers A and C incorrect. Answer D, obtaining blood gases, is ordered by the doctor. The healthcare provider prescribes 1 unit of packed red blood cells to infuse over 4 hours. 1 unit of blood contains 250 milliliters, and the drop factor is 10 drops per 1 milliliters. How many drops per minute should the nurse infuse? A. 8 drops per minute. B. 10 drops per minute. C. 12 drops per minute. D. 14 drops per minute. The correct answer is B. 10 drops per minute. Rationale: the prescribed 250 milliliter is to be infused over 4 hours. Follow the formula and multiply 250 milliliter by 10. Then divide the result by 240 minutes. The infusion is to run at 10.4 or 10 drops per minute. The nurse is assisting with caring for a client who is receiving a unit of packed red blood cells. The nurse should tell the client that it is most important to report which sign immediately. A. Sore throat or earache. B. Chills, itching, or rash. C. Unusual sleepiness or fatigue. D. Mild discomfort at the catheter site. The correct answer is B. Chills, itching, or rash. Rationale: the client is told to report chills, itching, or rash immediately because these could be signs of a possible transfusion reaction. Mild discomfort at the catheter site may be indicative of a problem, or it could result from the size of the IV catheter required to infuse the blood product. Sore throat, earache, sleepiness, and fatigue are unrelated to a transfusion reaction.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client is going to be transfused with a unit of packed red blood cells. The nurse understands that it is necessary to remain with the client for what time period after the transfusion is started? A. 5 minutes. B. 15 minutes. C. 30 minutes. D. 45 minutes. The correct answer is B. 15 minutes. Rationale: the nurse must remain with the client for the first 15 minutes of a transfusion, which is the most likely time that a transfusion reaction will occur. This enables the nurse to detect a reaction and intervene quickly. The nurse engages in safe nursing practice by obtaining coverage for the other clients during this time. 5 minutes is too short of a time period, while 30 minutes and 45 minutes are too long of a time period. A client who was receiving a blood transfusion has experienced a transfusion reaction. The nurse sends the blood bag that was used for the client to which area? A. The pharmacy. B. The laboratory. C. The blood bank. D. The risk management department. The correct answer is C. The blood bank. Rationale: the nurse prepares to return the blood transfusion bag containing any remaining blood to the blood bank. This allows the blood bank to complete any follow-up testing procedures that are needed after a transfusion reaction has been documented. A client tells the nurse about deciding to refuse external cardiac massage. Which should be the most appropriate initial nursing action? A. Discuss the client's request with the family. B. Document the client's request in the client's record. C. Notify the health care provider of the client's request. D. Conduct a client conference to share the client's request. The correct answer is C. Notify the health care provider of the client's request. Rationale: if a client decides to refuse external cardiac massage, the appropriate initial action is to notify the health care provider, because a written do not resuscitate prescription from the HCP must be present in the patient's chart. The DNR prescription must be reviewed or renewed on a regular basis per agency policy. The emergency department nurse receives a telephone call and is informed that a tornado has hit a local residential area and numerous casualties have occurred. The victims will be brought to the emergency department. Which should be the initial nursing action? A. Prepare the triage rooms. B. Activate the agency emergency response plan. C. Obtain additional supplies from the central supply department. D. Obtain additional nursing staff to assist with treating the casualties. The correct answer is B. Activate the agency emergency response plan. Rationale: during a widespread disaster, many people will be brought to the emergency department for treatment. Although options A, C, and D may be components of preparing for the casualties, the initial nursing action should be to activate the emergency response plan. The correct answer is B. Activate the agency emergency response plan. Rationale: during a widespread disaster, many people will be brought to the emergency department for treatment. Although options A, C, and D may be components of preparing for the casualties, the initial nursing action should be to activate the emergency response plan. The nurse is assigned to care for clients. When planning client rounds, which client should the nurse collect data from first? A. A client scheduled for a chest X-ray. B. A client requiring daily dressing changes. C. A postoperative client preparing for discharge. D. A client receiving oxygen, who is having difficulty breathing. The correct answer is D. A client receiving oxygen, who is having difficulty breathing. Rationale: the airway is always a priority, and the nurse would attend to the client, who has been experiencing an airway problem first. The clients described in options A, B, and C would have intermediate priority. The nurse employed in a long-term care facility is planning the client assignments for the shift. Which client should the nurse assign to the unlicensed assistive personnel? A. A client who requires a 24-hour urine collection. B. A client who requires twice daily dressing changes. C. A client who is on a bowel management program and requires rectal suppositories and a daily enema. D. A client with diabetes mellitus who requires daily insulin and the reinforcement of dietary measures. The correct answer is A. A client who requires a 24-hour urine collection. Rationale: the nurse must determine the most appropriate assignment on the basis of the skills of the staff member and the needs of the client. The assignment of tasks needs to be implemented on the basis of the job description of the individual's level of clinical competence and state law. Options B, C, and D involve care that requires the skill of a licensed nurse. A client is being treated for acute heart failure with intravenously administered bumetanide. The vital signs are as follows: blood pressure 100/60, pulse 96 beats per minute, and respirations 24 breaths per minute. After the initial dose, which is the priority assessment? A. Monitoring weight loss. B. Monitoring temperature. C. Monitoring blood pressure. D. Monitoring potassium level. The correct answer is C. Monitoring blood pressure. Rationale: bumetanide is a loop diuretic. Hypotension is a common side effect associated with the use of this medication. The other options also require assessment but are not the priority. The nurse provides medication instructions to an older hypertensive client who is taking 20 milligrams of lisinopril orally daily. The nurse evaluates the need for further teaching when the client makes which statement? A. I can skip a dose once a week. B. I need to change my position slowly. C. I take the pill after breakfast each day. D. If I get a bad headache, I should call my healthcare provider immediately. The correct answer is A. I can skip a dose once a week. Rationale: lisinopril is an antihypertensive angiotensin-converting enzyme inhibitor. The usual dosage range is 20 to 40 milligrams per day. Adverse effects include headache, dizziness, fatigue, orthostatic hypotension, tachycardia, and angioedema. Specific client teaching points include taking one pill a day, not stopping the medication without consulting the healthcare provider, and monitoring for side effects and adverse reactions. The client should notify the HCP if side effects occur. A client who is taking hydrochlorothiazide has been started on triamterene as well. The client asks the nurse why both medications are required. Which response is the most accurate to give to the client? A. Both are weak potassium-excreting diuretics. B. The combination of these medications prevents renal toxicity. C. Hydrochlorothiazide is an expensive medication, so using a combination of diuretics is cost-effective. D. Triamterene is a potassium-retaining diuretic, whereas hydrochlorothiazide is a potassium-excreting diuretic. The correct answer is D. Triamterene is a potassium-retaining diuretic, whereas hydrochlorothiazide is a potassium-excreting diuretic. Rationale: potassium-retaining diuretics include amiloride, spironolactone, and triamterene. They are weak diuretics that are used in combination with potassium-excreting diuretics. This combination is useful when medication and dietary supplement of potassium is not appropriate. The use of two different diuretics does not prevent renal toxicity. Hydrochlorothiazide is an effective and inexpensive generic form of the thiazide classification of diuretics. A client who has begun taking fosinapril is very distressed, telling the nurse that he cannot taste food normally since beginning the medication 2 weeks ago. Which suggestion would provide the best support for the client? A. Tell the client not to take the medication with food. B. Suggest that the client taper the dose until taste returns to normal. C. Inform the client that impaired taste is expected and generally disappears in 2 to 3 months. D. Tell the client that a request will be made to the healthcare provider to change the prescription. The correct answer is C. Inform the client that impaired taste is expected and generally disappears in 2 to 3 months. Rationale: ACE inhibitors, such as fosinapril, cause temporary impairment of taste. The nurse can tell the client that this effect usually disappears in 2 to 3 months, even with continued therapy, and provide nutritional counseling, if appropriate, to avoid weight loss. Options A, B, and D are inappropriate actions. Taking this medication with or without food does not affect absorption and action. The dosage should never be tapered without HCP approval, and the medication should never be stopped abruptly. The nurse should place the child who had a tonsillectomy in which position? A. Supine position. B. Side-lying position. C. High Fowler's position. D. Trendelenburg's position. The correct answer is B. Side-lying position. Rationale: the child should be placed in a semi-prone or side-lying position after tonsillectomy to facilitate drainage. Options A, C, and D will not achieve this goal. The nurse is instructing the mother of a child with cystic fibrosis about the appropriate dietary measures. Which meal best illustrates the most appropriate diet for a client with cystic fibrosis? A. Veggie salad and a caramel apple. B. Strawberry jelly sandwich and pretzels. C. Plate of nachos and cheese and a cupcake. D. Chicken tenders and a baked potato with butter. The correct answer is D. Chicken tenders and a baked potato with butter. Rationale: children with CF are managed with a high-calorie, high-protein diet. Pancreatic enzyme replacement therapy is undertaken, and fat-soluble vitamin supplements are administered. Fats are not restricted unless steatorrhea cannot be controlled by increased levels of pancreatic enzymes. Chicken tenders and a baked potato with butter provide a high-calorie and high-protein meal that includes fat. The nurse is preparing for the admission of an infant with a diagnosis of bronchiolitis caused by the respiratory syncytial virus. Which interventions should be included in the plan of care? Select all that apply. A. Place the infant in a private room. B. Place the infant in a room near the nurse's station. C. Ensure that the infant's head is in a flexed position. D. Wear a mask at all times when in contact with the infant. F. Place the child in a tent that delivers warm, humidified air. E. Position the infant side-lying, with the head lower than the chest. The correct answers are A. Place the infant in a private room, and B. Place the infant in a room near the nurse's station. Rationale: the infant with RSV should be isolated in a private room, or in a room with another child with RSV. The infant should be placed in a room near the nurse's station for close observation. The infant should be positioned with the head and chest at a 30 to 40 degree angle, and the neck slightly extended to maintain an open airway, and to decrease pressure on the diaphragm. Cool, humidified oxygen is delivered to relieve dyspnea, hypoxemia, and insensible water loss from tachypnea. Contact precautions reduce the nosocomial transmission of RSV. The nurse is working in the emergency department and is caring for a child who has been diagnosed with epiglottitis, which is an indication that the child may be experiencing airway obstruction. A. Nasal flaring and bradycardia. B. A low-grade fever and complaints of a sore throat. C. The child thrusts the chin forward and opens the mouth. D. The child leans backward, supporting himself or herself with the hands and arms. The correct answer is C. The child thrusts the chin forward and opens the mouth. Rationale: clinical manifestations that are suggestive of airway obstruction include tripod positioning, nasal flaring, tachycardia, a high fever, and a sore throat. The nurse reinforces instructions to the mother of a child with croup about the measures to take if an acute spasmodic episode occurs. Which statement by the mother indicates the need for further teaching? A. I will place a steam vaporizer in my child's room. B. I will take my child out into the humid night air. C. I will place a cool mist humidifier in my child's room. D. I will place my child in a closed bathroom and allow my child to inhale steam from the running water. The correct answer is A. I will place a steam vaporizer in my child's room. Rationale: steam from warm running water in a closed bathroom and cool mist from a bedside humidifier are effective for reducing mucosal edema. Cool mist humidifiers are recommended as compared with steam vaporizers, which present a danger of scalding burns. Taking the child out into the humid night air may also relieve mucosal swelling. Remember, however, that a cold mist may precipitate bronchospasm.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client is diagnosed with glaucoma. Which data gathered by the nurse indicate a risk factor associated with glaucoma? A. Cardiovascular disease. B. A history of migraine headaches. C. Frequent urinary tract infections. D. Frequent upper respiratory infections. The correct answer is A. Cardiovascular disease. Rationale: hypertension, cardiovascular disease, diabetes mellitus, and obesity are associated with the development of glaucoma. Smoking, ingestion of caffeine, or large amounts of alcohol, illicit drugs, corticosteroids, altered hormone levels, posture, and eye movements may cause varying transient increases in intraocular pressure. A client sustains a chemical eye injury from a splash of battery acid. The nurse should prepare the client for which immediate measure? A. Checking visual acuity. B. Covering the eye with a pressure patch. C. Swabbing the eye with antibiotic ointment. D. Irrigating the eye with sterile normal saline. The correct answer is D. Irrigating the eye with sterile normal saline. Rationale: emergency care after a chemical burn to the eye includes irrigating the eye immediately with sterile normal saline or ocular irrigating solution. The irrigation should be maintained for at least 10 minutes. After this emergency treatment, visual acuity is assessed. Options B and C are not immediate measures. The nurse is assigned to care for a client with a diagnosis of detached retina. Which finding would indicate that bleeding has occurred as a result of retinal detachment? A. Total loss of vision. B. A reddened conjunctiva. C. A sudden sharp pain in the eye. D. Complaints of a burst of black spots or floaters. The correct answer is D. Complaints of a burst of black spots or floaters. Rationale: complaints of a sudden burst of black spots or floaters indicate that bleeding has occurred as a result of the detachment. Options A, B, and C are not specifically associated with bleeding as a result of detached retina. The nurse is assigned to care for a client with a detached retina. Which finding should the nurse expect to be documented in the client's record? A. Blurred vision. B. Pain in the affected eye. C. A yellow discoloration of the sclera. D. A sense of a curtain falling across the field of vision. The correct answer is D. A sense of a curtain falling across the field of vision. Rationale: a characteristic clinical manifestation of retinal detachment described by clients is the feeling that a shadow or curtain is falling across the field of vision. There is no pain associated with detachment of the retina. A retinal detachment is an ophthalmic emergency, and even more so if visual acuity is still normal. Options A and C are not specifically associated with a detached retina. The nurse is preparing to reinforce a teaching plan for a client who is undergoing cataract extraction with intraocular implant. Which home care measures should the nurse include in the plan? Select all that apply. A. To avoid activities that require bending over. B. To contact the surgeon if eye scratchiness occurs. C. To place an eye shield on the surgical eye at bedtime. D. That episodes of sudden severe pain in the eye are expected. E. To contact the surgeon if a decrease in visual acuity occurs. F. To take acetaminophen for minor eye discomfort. The correct answers are A. To avoid activities that require bending over, C. To place an eye shield on the surgical eye at bedtime, E. To contact the surgeon if a decrease in visual acuity occurs, and F. To take acetaminophen for minor eye discomfort. Rationale: after eye surgery, some scratchiness and mild eye discomfort may occur in the operative eye and is usually relieved by mild analgesics. If the eye pain becomes severe, the client should notify the surgeon, because this may indicate hemorrhage, infection, or increased intraocular pressure. The nurse would also instruct the client to notify the surgeon of purulent drainage, increased redness, or any decrease in visual acuity. The client is instructed to place an eye shield over the operative eye at bedtime to protect the eye from injury during sleep and to avoid activities that increase intraocular pressure, such as bending over. The nurse is gathering data on a client with a diagnosis of tuberculosis. The nurse should review the results of which diagnostic test to confirm this diagnosis? A. Chest X-ray. B. Bronchoscopy. C. Sputum culture. D. Tuberculin skin test. The correct answer is C. Sputum culture. Rationale: a definitive diagnosis of TB is confirmed through culture and isolation of Mycobacterium tuberculosis. A presumptive diagnosis is made on the basis of a tuberculin skin test, a sputum smear that is positive for acid-fast bacteria, a chest X-ray, and histologic evidence of granulomatous disease on biopsy. The nurse is told that an assigned client will have a fenestrated tracheostomy tube inserted. The nurse should provide the client with which information about this type of tube? A. Enables the client to speak. B. Checking the respirations hourly. C. Prevents the client from speaking. D. Prevents air from being inhaled through the tracheostomy opening. The correct answer is A. Enables the client to speak. Rationale: a fenestrated tube has a small opening in the outer cannula that allows some air to escape through the larynx. This type of tube enables the client to speak. The nurse is assigned to assist with caring for a client who has a chest tube. The nurse notes fluctuations of the fluid level in the water seal chamber. Based on this observation, which action would be appropriate? A. Empty the drainage. B. Encourage the client to deep breathe. C. Continue to monitor, because this is an expected finding. D. Encourage the client to hold his or her breath periodically. The correct answer is C. Continue to monitor, because this is an expected finding. Rationale: the presence of fluctuations in the fluid level in the water seal chamber indicates a patent drainage system. With normal breathing, the water level rises with inspiration and falls with expiration. The apparatus and all connections must remain airtight at all times, and the drainage is never emptied because of the risk of disruption in the closed system, which can result in lung collapse. Encouraging the client to deep breathe is unrelated to this observation. The client is not told to hold his or her breath. The nurse is assigned to assist the health care provider with the removal of a chest tube. The nurse should reinforce instructing the client to do which during this process? A. Stay very still. B. Exhale forcefully. C. Inhale and exhale quickly. D. Perform Valsalva's maneuver. The correct answer is D. Perform Valsalva's maneuver. Rationale: when the chest tube is removed, the client is asked to perform Valsalva's maneuver, the tube is quickly withdrawn, and an airtight dressing is taped in place. An alternative instruction is to ask the client to take a deep breath and hold the breath while the tube is removed. The nurse is providing endotracheal suctioning to a client who is mechanically ventilated when the client becomes restless and tachycardic. Which action should the nurse take? A. Notify the rapid response team. B. Finish the suctioning as quickly as possible. C. Contact the respiratory department to suction the client. D. Discontinue suctioning until the client is stabilized and monitor vital signs. The correct answer is D. Discontinue suctioning until the client is stabilized and monitor vital signs. Rationale: if a client becomes cyanotic, or restless, or develops tachycardia, bradycardia, or another abnormal heart rhythm, the nurse must discontinue suctioning until the client is stabilized. It is also important to monitor the vital signs and the pulse oximetry. If the client's condition continues to deteriorate, then the respiratory department and healthcare provider may need to be notified. There is no data in the question that indicates that the rapid response team needs to be notified. The nurse is collecting data from a client who is pregnant with twins. The client has a healthy 5-year-old child who was delivered at 38 weeks, and she tells the nurse that she does not have a history of any type of abortion or fetal demise. The nurse should document the GTPAL for this client as which? A. G equals 3, T equals 2, P equals 0, A equals 0, L equals 1. B. G equals 2, T equals 1, P equals 0, A equals 0, L equals 1. C. G equals 1, T equals 1, P equals 1, A equals 0, L equals 1. D. G equals 2, T equals 0, P equals 0, A equals 0, L equals 1. The correct answer is B. G equals 2, T equals 1, P equals 0, A equals 0, L equals 1. Rationale: pregnancy outcomes can be described with the GTPAL acronym. G equals gravidity, number of pregnancies, T equals term births, number born after 37 weeks, P equals preterm births, number born before 37 weeks gestation, A equals abortion/miscarriages, number of abortions/miscarriages, L equals live births, number of live births or living children. Therefore, a woman who is pregnant with twins, and who already has a child, has a gravida of 2. Because the child was delivered at 38 weeks, the number of preterm births is 0, and the number of term births is 1. The number of abortions is 0, and the number of live births is 1. The client arrives at the prenatal clinic for her first prenatal assessment. The client tells the nurse that the first day of her last menstrual period was October 20, 2024. Using Nagel's rule, the nurse determines the estimated date of birth is which? A. July 12, 2025. B. July 27, 2025. C. August 12, 2025. D. August 27, 2025. The correct answer is B. July 27, 2025. Rationale: the accurate use of Nagel's rule requires that the woman have a regular 28-day menstrual cycle. Subtract 3 months from the first day of the last menstrual period, add 7 days, and then adjust the year as appropriate. In this case, the first day of the LMP was October 20, 2024. When you subtract 3 months, you get July 20, 2024. If you add 7 days, you get July 27, 2024. Add 1 year to this, and you get the estimated date of birth of July 27, 2025. The nurse is describing the process of fetal circulation to a client during a prenatal visit. The nurse should tell the client that fetal circulation consists of which? A. 2 umbilical veins and 1 umbilical artery. B. 2 umbilical arteries and 1 umbilical vein. C. Arteries that carry oxygenated blood to the fetus. D. Veins that carry deoxygenated blood to the fetus. The correct answer is B. 2 umbilical arteries and 1 umbilical vein. Rationale: blood pumped by the fetus's heart leaves the fetus through 2 umbilical arteries. After the blood is oxygenated, it is then returned by 1 umbilical vein. Arteries carry deoxygenated blood and waste products from the fetus. Veins carry oxygenated blood and provide oxygen and nutrients to the fetus. The charge nurse reviews the results of the arterial blood gases with the floor nurse and tells the floor nurse that the client is experiencing respiratory acidosis. The nurse should expect to note which on the laboratory result report: A. pH 7.50, PCO2 52 mm of mercury. B. pH 7.35, PCO2 40 mm of mercury. C. pH 7.25, PCO2 50 mm of mercury. D. pH 7.50, PCO2 30 mm of mercury. The correct answer is C. pH 7.25, PCO2 50 mm of mercury. Rationale: the normal pH is 7.35 to 7.45, and the normal PCO2 value is 35 to 45 mm of mercury. In respiratory acidosis, the pH is down, and the PCO2 is up. Therefore, the option with the pH of 7.25 and the PCO2 of 50 mm of mercury is the only option that reflects an acidotic condition. Options with an elevated pH indicate an alkalotic condition. Option B identifies normal values for pH and PCO2. When caring for the following group of clients, who does the nurse determine is at risk for development of metabolic alkalosis? Select all that apply. A. Client with emphysema. B. Client who is hyperventilating. C. Client with chronic kidney disease. D. Client who has been vomiting for 2 days. E. Client receiving furosemide 40 mg daily. F. Client admitted with acetylsalicylic acid overdose. The correct answer is D. Client who has been vomiting for 2 days, and E. Client receiving furosemide 40 mg daily. Rationale: metabolic alkalosis is caused by any condition that creates the acid-base imbalance through either an increase in bases or a deficit of acids, such as the client who has been vomiting for 2 days and the client receiving furosemide daily. Recall that clients with emphysema and hyperventilation are at risk for a respiratory acid-base disturbance. Chronic kidney disease and aspirin overdose will result in metabolic acidosis.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is caring for a client with diabetic ketoacidosis and observes that the client is experiencing abnormally deep, regular, rapid respirations. How should the nurse correctly document this observation in the medical record? A. Apnea observed. B. Bradypnea noted. C. Cheney-Stokes demonstrated. D. Kussmaul's respirations observed. The correct answer is D. Kussmaul's respirations observed. Rationale: abnormally deep, regular, and rapid respirations observed in the client with diabetic ketoacidosis are documented as Kussmaul's respirations. In apnea, respirations cease for several seconds. In bradypnea, respirations are regular but abnormally slow. Cheney-Stokes respirations gradually become more shallow and are followed by periods of apnea, with repetition of the pattern. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client closely for which acid-base disorder that is most likely to occur in this situation. A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. The correct answer is B. Metabolic alkalosis. Rationale: the loss of gastric fluid via nasogastric suction, or vomiting, causes a metabolic condition. This also results in an alkalotic condition due to the loss of hydrochloric acid through gastrointestinal fluid losses. Also, the options denoting a respiratory problem, respiratory acidosis, and respiratory alkalosis, can be easily eliminated. A client has the following laboratory values: a pH of 7.55, an HCO3 level of 22 mm of mercury, and a PCO2 of 30 mm of mercury. Which action should the nurse take? A. Perform Allen's test. B. Prepare the client for dialysis. C. Administer insulin as prescribed. D. Encourage the client to slow down breathing. The correct answer is D. Encourage the client to slow down breathing. Rationale: the client is in respiratory alkalosis based on the laboratory results of a high pH and a low PCO2 level. Interventions for respiratory alkalosis are the voluntary holding of breath, or slowed breathing, and the rebreathing of exhaled CO2 by methods such as using a paper bag or a rebreathing mask as prescribed. Performing Allen's test would be incorrect because the blood specimen has already been drawn and the laboratory results have been completed. Dialysis and insulin administration are interventions for metabolic acidosis. Oxybutynin chloride is prescribed for a client with a neurogenic bladder. Which sign would indicate a possible toxic effect related to this medication? A. Pallor. B. Drowsiness. C. Bradycardia. D. Restlessness. The correct answer is D. Restlessness. Rationale: toxicity of this medication produces central nervous system excitation, such as nervousness, restlessness, hallucinations, and irritability. Other signs of toxicity include hypotension or hypertension, confusion, tachycardia, flushed or red face, and signs of respiratory depression. Drowsiness is a frequent side effect of the medication, but does not indicate overdose. Phenazopyridine hydrochloride is prescribed for a client for symptomatic relief of pain, resulting from a lower urinary tract infection. Which should the nurse reinforce to the client? A. Take the medication at bedtime. B. Take the medication before meals. C. Discontinue the medication if a headache occurs. D. A reddish-orange discoloration of the urine may occur. The correct answer is D. A reddish-orange discoloration of the urine may occur. Rationale: the nurse should instruct the client that a reddish-orange discoloration of urine may occur. The nurse also should instruct the client that this discoloration can stain fabric. The medication should be taken after meals to reduce the possibility of gastrointestinal upset. A headache is an occasional side effect of the medication and does not warrant discontinuation of the medication. Methenamine, a urinary antiseptic, is prescribed for the client. The client's chart reads: blood glucose 102 mg per deciliter, chest X-ray, normal, renal insufficiency, folic acid 0.5 mg, orally daily. The nurse reviews the client's medical record and should contact the healthcare provider regarding which documented finding to verify the prescription. A. Renal insufficiency. B. Chest X-ray, normal. C. Blood glucose 102 mg per deciliter. D. Folic acid 0.5 mg, orally daily. The correct answer is A. Renal insufficiency. Rationale: methenamine is a urinary antiseptic. Methenamine can cause crystalluria and should not be used in clients with renal impairment. Therefore, the nurse would verify the prescription if the client had a documented history of renal insufficiency. The laboratory and diagnostic test results are normal findings. Folic acid may be prescribed for a client with renal insufficiency to prevent anemia. The client who has a cold is seen in the emergency department with an inability to void. Because the client has a history of benign prostatic hyperplasia, the nurse determines that the client should be questioned about the use of which medication. A. Diuretics. B. Antibiotics. C. Antitussives. D. Decongestants. The correct answer is D. Decongestants. Rationale: episodes of urinary retention can be triggered by certain medications such as decongestants, anticholinergics, and antidepressants. Diuretics, antibiotics, and antitussives generally do not trigger urinary retention. Retention also can be precipitated by other factors such as alcoholic beverages, infection, bed rest, and becoming chilled. Dantrolene sodium is prescribed for a client experiencing flexor spasms, and the client asks the nurse about the action of the medication. The nurse responds knowing that, which is the therapeutic action of this medication. A. Depresses spinal reflexes. B. Acts directly on the skeletal muscle to relieve spasticity. C. Acts within the spinal cord to suppress hyperactive reflexes. D. Acts on the central nervous system to suppress spasms. The correct answer is B. Acts directly on the skeletal muscle to relieve spasticity. Rationale: dantrolene acts directly on skeletal muscle to relieve muscle spasticity. The primary action is the suppression of calcium release from the sarcoplasmic reticulum. This in turn decreases the ability of the skeletal muscle to contract. Options A, C, and D are not actions of the medication. The nurse is reviewing the record of a client who has been prescribed baclofen. Which disorder should alert the nurse to contact the healthcare provider? A. Seizure disorders. B. Hyperthyroidism. C. Diabetes mellitus. D. Coronary artery disease. The correct answer is A. Seizure disorders. Rationale: clients with seizure disorders may have a lowered seizure threshold when baclofen is administered. Concurrent therapy may require an increase in the anticonvulsive medication. The disorders in options B, C, and D are not a concern when the client is taking baclofen. A client with acute muscle spasms has been taking baclofen. The client calls the clinic nurse because of continuous feelings of weakness and fatigue and asks the nurse about discontinuing the medication. The nurse should make which appropriate response to the client? A. You should never stop the medication. B. It is best that you taper the dose if you intend to stop the medication. C. It is okay to stop the medication if you think that you can tolerate the muscle spasms. D. Weakness and fatigue commonly occur and will diminish with continued medication use. The correct answer is D. Weakness and fatigue commonly occur and will diminish with continued medication use. Rationale: the client should be instructed that symptoms such as drowsiness, weakness, and fatigue are more intense in the early phase of therapy and diminish with continued medication use. The client should be instructed never to withdraw or stop the medication abruptly, because abrupt withdrawal can cause visual hallucinations, paranoid ideation, and seizures. It is best for the nurse to inform the client that these symptoms will subside and encourage the client to continue the use of the medication. The nurse is monitoring a client receiving baclofen for side effects related to the medication, which should indicate that the client is experiencing a side effect. A. Polyuria. B. Diarrhea. C. Drowsiness. D. Muscular excitability. The correct answer is C. Drowsiness. Rationale: baclofen is a central nervous system depressant and frequently causes drowsiness, dizziness, weakness, and fatigue. It can also cause nausea, constipation, and urinary retention. Clients should be warned about the possible reactions. Options A, B, and D are not side effects. The nurse is reinforcing instructions to a client with iron deficiency anemia about iron-rich foods. Which food sources should the nurse include in the discharge teaching plan of a client with iron deficiency anemia? Select all that apply. A. Milk. B. Fish. C. Eggs. D. Liver. E. Cheese. The correct answers are C. Eggs and D. Liver. Rationale: liver and muscle meats, eggs, dried fruits, and dark green, leafy vegetables are iron-rich foods. Milk, fish, and cheese are not significant sources of iron. The nurse is caring for a client with a suspected diagnosis of aplastic anemia. Which tests should the nurse anticipate to be performed to confirm the diagnosis? A. Schilling test. B. Sickle cell screen. C. Bone marrow aspiration. D. Complete blood cell count. The correct answer is C. Bone marrow aspiration. Rationale: a bone marrow aspiration will identify aplastic anemia and will identify pancytopenia, a deficiency in erythrocytes, leukocytes, and thrombocytes. A Schilling test is diagnostic for pernicious anemia. A sickle cell screen is diagnostic for sickle cell anemia. A complete blood cell count will identify anemia but may not identify the specific type. The nurse is reviewing the laboratory results of a client receiving chemotherapy. The nurse prepares to initiate neutropenic precautions when the nurse notes which laboratory result. A. A bleeding time of 3 minutes. B. An ammonia level of 20 micrograms per deciliter. C. A platelet count of 200,000 cells per cubic millimeter. D. A white blood cell count of 2,000 cells per cubic millimeter. The correct answer is D. A white blood cell count of 2,000 cells per cubic millimeter. Rationale: the normal white blood cell count is 5,000 to 10,000 cells per cubic millimeter. When the white blood cell count drops, neutropenic precautions need to be implemented. This includes protective isolation measures to protect the client from infection. Bleeding precautions need to be initiated when the platelet count drops. Bleeding precautions include avoiding all trauma such as rectal temperatures or injections. The normal platelet count is 150,000 to 450,000 cells per cubic millimeter. The normal bleeding time is 1 to 6 minutes, depending on laboratory method used. The normal ammonia value is 10 to 80 micrograms per deciliter. The nurse is caring for a client with a suspected diagnosis of hypercalcemia. Which sign/symptom is an indication of this electrolyte imbalance? A. Twitching. B. Positive Trousseau's sign. C. Hyperactive bowel sounds. D. Generalized muscle weakness. The correct answer is D. Generalized muscle weakness. Rationale: generalized muscle weakness is seen in clients with hypercalcemia. Twitching, positive Trousseau's sign, and hyperactive bowel sounds are signs of hypocalcemia.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is caring for a client with leukemia and notes that the client has poor skin turgor and flat neck and hand veins. The nurse suspects hyponatremia. Which additional signs/symptoms should the nurse expect to note in this client if hyponatremia is present? A. Intense thirst. B. Slow bounding pulse. C. Dry mucous membranes. D. Postural blood pressure changes. The correct answer is D. Postural blood pressure changes. Rationale: postural blood pressure changes occur in the client with hyponatremia. Intense thirst and dry mucous membranes are seen in clients with hypernatremia. A slow, bounding pulse is not indicative of hyponatremia. In a client with hyponatremia, a rapid, thready pulse is noted. The nurse is reviewing the health records of assigned clients. The nurse should plan care knowing that which client is at risk for fluid volume deficit. A. The client with cirrhosis. B. The client with a colostomy. C. The client with heart failure. D. The client with decreased kidney function. The correct answer is B. The client with a colostomy. Rationale: causes of a fluid volume deficit include vomiting, diarrhea, conditions that cause increased respirations, or increased urinary output, insufficient intravenous fluid replacement, draining fistulas, ileostomy, and colostomy. A client with cirrhosis, heart failure, or decreased kidney function is at risk for fluid volume excess. The nurse is providing directions to the unlicensed assistive personnel regarding clients' hygiene needs. Which is the priority order in which the UAP should assist the clients? Arrange the actions in the order that they should be performed. All options must be used. 1. A client who is independent with ADL. 2. A confused client who is incontinent of stool and urine. 3. A client who is on bed rest after multiple trauma. 4. A client who was admitted for dehydration and failure to thrive. The correct order is 2. A confused client who is incontinent of stool and urine. 3. A client who is on bed rest after multiple trauma. 4. A client who was admitted for dehydration and failure to thrive. And 1. A client who is independent with ADL. Rationale: the confused client should be bathed first because bowel/bladder incontinence would lead to skin breakdown. The client who has multiple traumas is at risk to develop skin breakdown and wound infection. The client who was admitted for dehydration and failure to thrive requires assistance with hygiene needs. The client who is independent with activities of daily living does not require assistance with hygiene. A client with a major burn is admitted to the emergency department. In which priority order should the nurse implement these actions? Arrange the actions in the order that they should be performed. All options must be used. 1. Establish airway. 2. Insert Foley catheter. 3. Initiate fluid therapy. 4. Insert a nasogastric tube. The correct order is 1. Establish airway, 3. Initiate fluid therapy, 2. Insert Foley catheter, and 4. Insert a nasogastric tube. Rationale: the actions that the nurse would take include the following. 1. Establish an airway. Administer oxygen as prescribed. Often the healthcare provider inserts an endotracheal tube to ensure a patent airway. 2. Initiate fluid therapy. Intravenous fluid therapy, usually with Ringer's lactate solution, is started immediately. The amount of fluid given is related to the percentage of total body surface area burned. The client is weighted, so the HCP can determine the amount of fluids needed. 3. A Foley catheter is inserted for hourly urinary output. An hourly output of 30 to 50 milliliters is recommended. Intravenous fluids will assist in maintaining renal perfusion. 4. A nasogastric tube is inserted because clients with severe burns often develop a paralytic ileus as a result of trauma. The intravenous prescription is 3,000 milliliters of 5% dextrose to run over a 24-hour period. The drop factor is 10 drops per 1 milliliter. The nurse plans to adjust the flow rate to how many drops per minute. Round the answer to the nearest whole number. A. 19 drops per minute. B. 20 drops per minute. C. 21 drops per minute. D. 22 drops per minute. The correct answer is C. 21 drops per minute. Rationale: the prescribed 3,000 milliliters is to be infused over 24 hours. Follow the formula and multiply 3,000 milliliters by 10. Then divide the result by 1,440 minutes. The infusion is to run at 20.8 or 21 drops per minute. The medication prescribed is digoxin, 0.25 milligrams orally, daily. The medication label reads digoxin, 0.125 milligrams per 1 tablet. The nurse should prepare how many tablet to administer the dose. A. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. The correct answer is B. 2 tablets. Rationale: the formula for this question is desired times quantity over on hand equals to tablets per dose. So in this question, desired is 0.25 milligrams, quantity is 1 tablet, on hand is 0.125 milligrams. You plug these numbers into the formula, so 0.25 milligrams times 1 tablet over 0.125 milligrams equals to 2 tablets. The medication prescribed is hydromorphone hydrochloride, 3 milligrams intramuscularly, every 4 hours as needed. The medication label reads hydromorphone hydrochloride, 4 milligrams per 1 milliliter. The nurse should prepare to administer how many milliliter to the client. A. 0.70 milliliters. B. 0.50 milliliters. C. 0.75 milliliters. D. 0.80 milliliters. The correct answer is C. 0.75 milliliters. Rationale: the formula for this question is desired times quantity over on hand equals to milliliter per dose. So in this question, desired is 3 milligrams, quantity is 1 milliliter, on hand is 4 milligrams. You plug these numbers into the formula, so 3 milligrams times 1 milliliter over 4 milligrams equals to 0.75 milliliters. The nurse is assigned to care for a child who is scheduled for an appendectomy. Which prescriptions does the nurse anticipate to be prescribed? Select all that apply. A. Administer a fleet enema. B. Initiate an intravenous line. C. Maintain nothing by mouth status. D. Administer intravenous antibiotics. E. Administer preoperative medications. F. Place a heating pad on the abdomen to decrease pain. The correct answers are B. Initiate an intravenous line, C. Maintain nothing by mouth status, D. Administer intravenous antibiotics, and E. Administer preoperative medications. Rationale: during the preoperative period, enemas or laxatives should not be administered. In addition, heat should not be applied to the abdomen. Any of these interventions can cause the rupture of the appendix and resultant peritonitis. Intravenous fluids would be started, and the child should receive nothing by mouth while awaiting surgery. Antibiotics are usually administered because of the risk of perforation. Preoperative medications are administered as prescribed. The nurse is caring for a client following a supratentorial craniotomy, in which a large tumor was removed from the left side. In which position can the nurse safely place the client? Refer to figures. A. Bed 1. B. Bed 2. C. Bed 3. D. Bed 4. The correct answer is A. Bed 1. Rationale: clients who have undergone supratentorial surgery should have the head of the bed elevated 30 degrees to promote venous drainage from the head. The client is positioned to avoid extreme hip or neck flexion, and the head is maintained in a midline neutral position. If a large tumor has been removed, the client should be placed on the non-operative side to prevent displacement of the cranial contents. A flat position or Trendelenburg's position would increase intracranial pressure. A reverse Trendelenburg's position would not be helpful and may be uncomfortable for the client. The client is experiencing dawn phenomena associated with diabetes mellitus. Which action by the nurse indicates knowledge of dawn phenomena? A. The nurse offers peanut butter and crackers as a snack prior to bedtime. B. The nurse wakes the client during the night to check her blood glucose level. C. The nurse administers NPH insulin subcutaneously as ordered. D. The nurse explains the need for frequent cortisol levels to be checked. The correct answer is B. The nurse wakes the client during the night to check her blood glucose level. Rationale: dawn phenomena occurs when there is a decrease in blood glucose levels during the night, with elevations in the early morning. Treatment of dawn phenomena includes waking the client to check blood glucose levels and sliding scale insulin administration. Answer A is incorrect because offering peanut butter and crackers will help to prevent the Somogyi effect, not dawn phenomena. Answer C is incorrect because administering NPH insulin will not treat or prevent dawn phenomena. Answer D is incorrect because there is no need to check cortisol levels when the client is experiencing dawn phenomena. Phenazopyridine is prescribed for a client with a urinary tract infection. The nurse evaluates that the medication is effective based on which observation? A. Urine is clear amber. B. Urination is not painful. C. Urge incontinence is not present. D. A reddish-orange discoloration of the urine is present. The correct answer is B. Urination is not painful. Rationale: phenazopyridine is a urinary analgesic. It is effective when it eliminates pain and burning with urination. It does not eliminate the bacteria causing the infection, so it would not make the urine clear amber. It does not treat urge incontinence. It will cause the client to have reddish-orange discoloration of urine, but this is a side effect of the medication, not the desired effect. A client who has a cold is seen in the emergency department with an inability to void. Because the client has a history of benign prostatic hyperplasia, the nurse determines that the client should be questioned about the use of which medication. A. Diuretics. B. Antibiotics. C. Antilipemics. D. Decongestants. The correct answer is D. Decongestants. Rationale: in the client with benign prostatic hyperplasia, episodes of urinary retention can be triggered by certain medications, such as decongestants, anticholinergics, and antidepressants. These medications lessen the voluntary ability to contract the bladder. The client should be questioned about the use of these medications if he has urinary retention. Diuretics increase urine output. Antibiotics and antilipemics do not affect ability to urinate. The nurse is caring for a client who takes ibuprofen for pain. The nurse is gathering information on the client's medication history and determines it is necessary to contact the healthcare provider if the client is also taking which medications that are contraindicated for use with ibuprofen. Select all that apply. A. Warfarin. B. Glympyride. C. Amlodipine. D. Simvastatin. E. Hydrochlorothiazide. The correct answers are A. Warfarin, B. Glympyride, and C. Amlodipine. Rationale: nonsteroidal anti-inflammatory drugs such as ibuprofen can amplify the effects of anticoagulants, such as warfarin, therefore, these medications should not be taken together. Hypoglycemia may result for the client taking ibuprofen if the client is concurrently taking an oral hypoglycemic agent, such as glympyride. These medications should not be combined. A high risk of toxicity exists if the client is taking ibuprofen concurrently with a calcium channel blocker such as amlodipine, therefore, this combination is contraindicated. The nurse reviews a client's electrolyte laboratory report and notes that the potassium level is 2.5 milliequivalents per liter. Which patterns should the nurse watch for on the electrocardiogram as a result of the laboratory value? Select all that apply. A. U waves. B. Absent P waves. C. Inverted T waves. D. Depressed ST segment. E. Widened QRS complex. The correct answers are A. U waves, C. Inverted T waves, and D. Depressed ST segment. Rationale: the normal serum potassium level is 3.5 to 5.0 milliequivalents per liter. A serum potassium level lower than 3.5 milliequivalents per liter indicates hypokalemia. Electrocardiographic changes include shallow, flat, or inverted T waves, ST segment depression, and prominent U waves. Absent P waves are not a characteristic of hypokalemia, but may be noted in a client with atrial fibrillation, junctional rhythms, or ventricular rhythms. A widened QRS complex may be noted in hyperkalemia and in hypermagnesemia. The nurse notes that a client with schizophrenia and receiving an antipsychotic medication is moving her mouth, protruding her tongue, and grimacing as she watches television. The nurse determines that the client is experiencing which medication complication? A. Parkinsonism. B. Tardive dyskinesia. C. Hypertensive crisis. D. Neuroleptic malignant syndrome. The correct answer is B. Tardive dyskinesia. Rationale: tardive dyskinesia is a reaction that can occur from antipsychotic medication. It is characterized by uncontrollable involuntary movements of the body and extremities, particularly the tongue. Parkinsonism is characterized by tremors, mask-like facies, rigidity, and a shuffling gait. Hypertensive crisis can occur from the use of monoamine oxidase inhibitors and is characterized by hypertension, occipital headache radiating frontally, neck stiffness and soreness, nausea, and vomiting. Neuroleptic malignant syndrome is a potentially fatal syndrome that may occur at any time during therapy with neuroleptic medications. It is characterized by dyspnea or tachypnea, tachycardia, or irregular pulse rate, fever, blood pressure changes, increased sweating, loss of bladder control, and skeletal muscle rigidity.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is describing the medication side and adverse effects to a client who is taking oxazepam. Which information should the nurse incorporate in the discussion? A. Consume a low-fiber diet. B. Increase fluids and bulk in the diet. C. Rest if the heart begins to beat rapidly. D. Take antidiarrheal agents if diarrhea occurs. The correct answer is B. Increase fluids and bulk in the diet. Rationale: oxazepam causes constipation, and the client is instructed to increase fluid intake and bulk in the diet. If the heart begins to beat fast, the healthcare provider is notified because this could indicate overdose. In addition, diarrhea could indicate an incomplete intestinal obstruction, and if this occurs, the HCP is notified. A client with schizophrenia has been started on medication therapy with clozapine. The nurse should assess the results of which laboratory study to monitor for adverse effects from this medication. A. Platelet count. B. Blood glucose level. C. Liver function studies. D. White blood cell count. The correct answer is D. White blood cell count. Rationale: a client taking clozapine may experience agranulocytosis, which is monitored by reviewing the results of the white blood cell count. Treatment is interrupted if the white blood cell count decreases to less than 3,000 cubic millimeter. Agranulocytosis could be fatal if undetected and untreated. The other laboratory studies are not related specifically to the use of this medication. A client has been taking isoniazid for 2 months. The client complains to the nurse about numbness, paresthesias, and tingling in the extremities. The nurse interprets that the client is experiencing which problem? A. Hypercalcemia. B. Peripheral neuritis. C. Small blood vessel spasm. D. Impaired peripheral circulation. The correct answer is B. Peripheral neuritis. Rationale: isoniazid is an antitubercular medication. A common side effect of isoniazid is peripheral neuritis, manifested by numbness, tingling, and paresthesias in the extremities. This can be minimized with pyridoxine intake. Options A, C, and D are not associated with the information in the question. The nurse is preparing to administer a dose of naloxone intravenously to a client with an opioid overdose. Which supportive medical equipment should the nurse plan to have at the client's bedside if needed? A. Nasogastric tube. B. Paracentesis tray. C. Resuscitation equipment. D. Central line insertion tray. The correct answer is C. Resuscitation equipment. Rationale: the nurse administering naloxone for suspected opioid overdose should have resuscitation equipment readily available to support naloxone therapy, if it is needed. Other adjuncts that may be needed include oxygen, a mechanical ventilator, and vasopressors. A cromolyn sodium inhaler is prescribed for a client with allergic asthma. The nurse provides instructions regarding the adverse effects of this medication and should tell the client that which undesirable effect is associated with this medication. A. Insomnia. B. Constipation. C. Hypotension. D. Bronchospasm. The correct answer is D. Bronchospasm. Rationale: cromolyn sodium is an inhaled nonsteroidal anti-allergy agent and a mast cell stabilizer. Undesirable effects associated with inhalation therapy of cromolyn sodium are bronchospasm, cough, nasal congestion, throat irritation, and wheezing. Clients receiving this medication orally may experience pruritus, nausea, diarrhea, and myalgia. Zefuroxyst is prescribed for a client with bronchial asthma. Which laboratory test does the nurse expect to be prescribed before the administration of this medication? A. Platelet count. B. Neutrophil count. C. Liver function tests. D. Complete blood count. The correct answer is C. Liver function tests. Rationale: zefuroxyst is a leukotriene receptor antagonist used in the prophylaxis and long-term treatment of bronchial asthma. Zefuroxyst is used with caution in clients with impaired hepatic function. Liver function laboratory tests should be performed to obtain a baseline, and the levels should be monitored during administration of the medication. It is not necessary to perform the other laboratory tests before administration of the medication. The nurse is assessing the neurovascular status of a client who returned to the surgical nursing unit 4 hours ago after undergoing aortoiliac bypass graft. The affected leg is warm and the nurse notes redness and edema. The pedal pulse is palpable and unchanged from admission. How should the nurse correctly interpret the client's neurovascular status? A. The neurovascular status is normal because of increased blood flow through the leg. B. The neurovascular status is moderately impaired and the surgeon should be called. C. The neurovascular status is slightly deteriorating and should be monitored for another hour. D. The neurovascular status is adequate from an arterial approach, but venous complications are arising. The correct answer is A. The neurovascular status is normal, because of increased blood flow through the leg. Rationale: an expected outcome of aortoiliac bypass graft surgery is warmth, redness, and edema in the surgical extremity, because of increased blood flow. The remaining options are incorrect interpretations. The nurse is caring for a client who has just had implantation of an automatic internal cardioverter defibrillator. The nurse should assess which item based on priority. A. Anxiety level of the client and family. B. Presence of a medic alert card for the client to carry. C. Knowledge of restrictions on post-discharge physical activity. D. Activation status of the device, heart rate cutoff, and number of shocks it is programmed to deliver. The correct answer is D. Activation status of the device, heart rate cutoff, and number of shocks it is programmed to deliver. Rationale: the nurse who is caring for the client, after insertion of an automatic internal cardioverter defibrillator, needs to assess device settings, similar to after insertion of a permanent pacemaker. Specifically, the nurse needs to know whether the device is activated, the heart rate cutoff above which it will fire, and the number of shocks it is programmed to deliver. The remaining options are also nursing interventions but are not the priority. A client is wearing a continuous cardiac monitor, which begins to sound its alarm. The nurse sees no electrocardiographic complexes on the screen. Which is the priority nursing action? A. Call a code. B. Call the healthcare provider. C. Check the client's status and lead placement. D. Press the recorder button on the electrocardiogram console. The correct answer is C. Check the client's status and lead placement. Rationale: sudden loss of electrocardiographic complexes indicates ventricular asystole or possibly electrode displacement. Accurate assessment of the client and equipment is necessary to determine the cause and identify the appropriate intervention. The remaining options are secondary to client assessment. A client admitted to the hospital with chest pain and a history of type 2 diabetes mellitus is scheduled for cardiac catheterization. Which medication would need to be withheld for 24 hours before the procedure and for 48 hours after the procedure? A. Glipizide. B. Metformin. C. Repaglinide. D. Regular insulin. The correct answer is B. Metformin. Rationale: metformin needs to be withheld 24 hours before and for 48 hours after cardiac catheterization, because of the injection of contrast medium during the procedure. If the contrast medium affects kidney function, with metformin in the system, the client would be at increased risk for lactic acidosis. The medications in the remaining options do not need to be withheld 24 hours before and 48 hours after cardiac catheterization. A client with trigeminal neuralgia is being treated with carbamazepine, 400 mg orally daily. Which value indicates that the client is experiencing an adverse effect to the medication? A. Sodium level, 140 milliequivalents per liter. B. Uric acid level, 4.0 mg per deciliter. C. White blood cell count, 3000 cubic millimeter. D. Blood urea nitrogen level, 10 mg per deciliter. The correct answer is C. White blood cell count, 3000 cubic millimeter. Rationale: adverse effects of carbamazepine appear as blood dyscrasias, including aplastic anemia, agranulocytosis, thrombocytopenia, and leukopenia, cardiovascular disturbances, including thrombophlebitis and dysrhythmias, and dermatological effects. The low white blood cell count reflects agranulocytosis. The laboratory values in options A, B, and D are normal values. A client is taking the prescribed dose of phenytoin to control seizures. Results of a phenytoin blood level study reveal a level of 35 micrograms per milliliters. Which finding would be expected as a result of this laboratory result? A. Hypotension. B. Tachycardia. C. Slurred speech. D. No abnormal finding. The correct answer is C. Slurred speech. Rationale: the therapeutic phenytoin level is 10 to 20 micrograms per milliliters. At a level higher than 20 micrograms per milliliters, involuntary movements of the eyeballs can occur. At a level higher than 30 micrograms per milliliters, ataxia and slurred speech can occur. The nurse is caring for a client in the emergency department who has been diagnosed with Bell's palsy. The client has been taking acetaminophen, and acetaminophen overdose is suspected. Which antidote should the nurse prepare for administration if prescribed? A. Pentostatin. B. Oranofen. C. Fludarabine. D. Acetylcysteine. The correct answer is D. Acetylcysteine. Rationale: the antidote for acetaminophen is acetylcysteine. The normal therapeutic serum level of acetaminophen is 10 to 20 micrograms per milliliters. A toxic level is higher than 50 micrograms per milliliters, and levels higher than 100 micrograms per milliliters could indicate hepatotoxicity. Oranofen is a gold preparation that may be used to treat rheumatoid arthritis. Pentostatin and fludarabine are antineoplastic agents. Carbidopa-levodopa is prescribed for a client with Parkinson's disease. The nurse monitors the client for side and adverse effects of the medication. Which finding indicates that the client is experiencing an adverse effect? A. Pruritus. B. Tachycardia. C. Hypertension. D. Impaired voluntary movements. The correct answer is D. Impaired voluntary movements. Rationale: dyskinesia and impaired voluntary movements may occur with high carbidopa-levodopa dosages. Nausea, anorexia, dizziness, orthostatic hypotension, bradycardia, and akinesia are frequent side effects of the medication. The home health care nurse is visiting a client who was recently diagnosed with type 2 diabetes mellitus. The client is prescribed repaglinide and metformin. The nurse should provide which instructions to the client? Select all that apply. A. Diarrhea may occur secondary to the metformin. B. The repaglinide is not taken if a meal is skipped. C. The repaglinide is taken 30 minutes before eating. D. A simple sugar food item is carried and used to treat mild hypoglycemia episodes. F. Muscle pain is an expected effect of metformin and may be treated with acetaminophen. E. Metformin increases hepatic glucose production to prevent hypoglycemia associated with repaglinide. The correct answers are A. Diarrhea may occur secondary to the metformin. B. The repaglinide is not taken if a meal is skipped. C. The repaglinide is taken 30 minutes before eating. And D. A simple sugar food item is carried and used to treat mild hypoglycemia episodes. Rationale: repaglinide, a rapid-acting oral hypoglycemic agent that stimulates pancreatic insulin secretion, should be taken before meals and should be withheld if the client does not eat. Hypoglycemia is a side effect of repaglinide, and the client should always be prepared by carrying a simple sugar at all times. Metformin is an oral hypoglycemic given in combination with repaglinide and works by decreasing hepatic glucose production. A common side effect of metformin is diarrhea. Muscle pain may occur as an adverse effect from metformin, but it might signify a more serious condition that warrants healthcare provider notification, not the use of acetaminophen.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The healthcare provider prescribes exenatide for a client with type 1 diabetes mellitus who takes insulin. The nurse should plan to take which most appropriate intervention? A. Withhold the medication and call the HCP, questioning the prescription for the client. B. Administer the medication within 60 minutes before the morning and evening meal. C. Monitor the client for gastrointestinal side effects after administering the medication. D. Withdraw the insulin from the pre-filled pen into an insulin syringe to prepare for administration. The correct answer is A. Withhold the medication and call the HCP, questioning the prescription for the client. Rationale: exenatide is an incretin mimetic used for type 2 diabetes mellitus only. It is not recommended for clients taking insulin. Hence, the nurse should withhold the medication and question the HCP regarding this prescription. Although options B and C are correct statements about the medication, in this situation the medication should not be administered. The medication is packaged in pre-filled pens, ready for injection, without the need for drawing it up into another syringe. Glimepiride is prescribed for a client with diabetes mellitus. The nurse instructs the client that which food items are most acceptable to consume while taking this medication. Select all that apply. A. Alcohol. B. Red meats. C. Whole grain cereals. D. Low-calorie desserts. The correct answers are B. Red meats and C. Whole grain cereals. Rationale: when alcohol is combined with glimepiride, a disulfiram-like reaction may occur. This syndrome includes flushing, palpitations, and nausea. Alcohol can also potentiate the hypoglycemic effects of the medication. Clients need to be instructed to avoid alcohol consumption while taking this medication. Low-calorie desserts should also be avoided. Even though the calorie content may be low, carbohydrate content is most likely high and can affect the blood glucose. The nurse is teaching a client how to mix regular insulin and NPH insulin in the same syringe. Which action, if performed by the client, indicates the need for further teaching? A. Withdraws the NPH insulin first. B. Withdraws the regular insulin first. C. Injects air into NPH insulin vial first. D. Injects an amount of air equal to the desired dose of insulin into each vial. The correct answer is A. Withdraws the NPH insulin first. Rationale: when preparing a mixture of short-acting insulin, such as regular insulin, with another insulin preparation, the short-acting insulin is drawn into the syringe first. This sequence will avoid contaminating the vial of short-acting insulin with insulin of another type. Options B, C, and D identify correct actions for preparing NPH and short-acting insulin. An adult client with hepatic encephalopathy has a serum ammonia level of 120 micrograms per deciliter and receives treatment with lactulose syrup. The nurse determines that the client has the best response if the level changes to which after medication administration. A. 2 micrograms per deciliter. B. 5 micrograms per deciliter. C. 70 micrograms per deciliter. D. 100 micrograms per deciliter. The correct answer is C. 70 micrograms per deciliter. Rationale: the normal serum ammonia level is 10 to 80 micrograms per deciliter. In the client with hepatic encephalopathy, the serum level is not likely to drop below normal. The most optimal, yet realistic change from the options provided would be 70 micrograms per deciliter, which falls in the normal range. A level of 100 micrograms per deciliter represents an insufficient effect of the medication. Lactulose is administered for its hyperosmotic laxative effect, thus removing ammonia from the colon. The client should also be monitored for hypokalemia, resulting from the severe purging lactulose causes. The client with a gastric ulcer has a prescription for sucralfate 1 gram by mouth 4 times daily. The nurse should schedule the medication for which times? A. With meals and at bedtime. B. Every 6 hours around the clock. C. 1 hour after meals and at bedtime. D. 1 hour before meals and at bedtime. The correct answer is D. 1 hour before meals and at bedtime. Rationale: sucralfate is a gastric protectant. The medication should be scheduled for administration 1 hour before meals and at bedtime. The medication is timed to allow it to form a protective coating over the ulcer before food intake stimulates gastric acid production and mechanical irritation. The client who frequently uses nonsteroidal anti-inflammatory drugs has been taking misoprostol. The nurse determines that the medication is having the intended therapeutic effect, if which is noted. A. Resolved diarrhea. B. Relief of epigastric pain. C. Decreased platelet count. D. Decreased white blood cell count. The correct answer is B. Relief of epigastric pain. Rationale: the client, who frequently uses nonsteroidal anti-inflammatory drugs, is prone to gastric mucosal injury. Misoprostol is a gastric protectant and is given specifically to prevent this occurrence. Diarrhea can be a side effect of the medication, but it is not an intended effect. The client has begun medication therapy with pancrelipase. The nurse evaluates that the medication is having the optimal intended benefit, if which effect is observed. A. Weight loss. B. Relief of heartburn. C. Reduction of steatorrhea. D. Absence of abdominal pain. The correct answer is C. Reduction of steatorrhea. Rationale: pancrelipase is a pancreatic enzyme used in clients with pancreatitis as a digestive aid. The medication should reduce the amount of fatty stools. Another intended effect could be improved nutritional status. It is not used to treat abdominal pain or heartburn. Its use could result in weight gain, but should not result in weight loss if it is aiding in digestion. The client has a PRN prescription for loperamide hydrochloride. The nurse understands that this medication is used for which condition? A. Constipation. B. Abdominal pain. C. An episode of diarrhea. D. Hematase-positive nasogastric tube drainage. The correct answer is C. An episode of diarrhea. Rationale: loperamide is an antidiarrheal agent. It is used to manage acute and also chronic diarrhea in conditions such as inflammatory bowel disease. Loperamide also can be used to reduce the volume of drainage from an ileostomy. The nurse is planning to put aneurysm precautions in place for the client with a cerebral aneurysm. Which item should be included as part of the precautions? A. Limiting cigarettes to 3 per day. B. Allowing out-of-bed activities as tolerated. C. Maintaining the head of the bed at 15 degrees. D. Allowing 1 cup of caffeinated coffee per day. The correct answer is C. Maintaining the head of the bed at 15 degrees. Rationale: aneurysm precautions include placing the client on bed rest, with the head of the bed elevated in a quiet setting. Lights are kept dim to minimize environmental stimulation. Any activity such as pushing, pulling, sneezing, coughing, or straining that increases blood pressure or impedes venous return from the brain is prohibited. The nurse provides all physical care to minimize increases in blood pressure. For the same reason, visitors, radio, television, and reading materials are prohibited or limited. Stimulants such as caffeine and nicotine are prohibited. Decaffeinated coffee or tea may be given. The nurse is assigned to care for an adult client who had a stroke and is aphasic. Which interventions should the nurse use for communicating with the client? Select all that apply. A. Face the client when talking. B. Speak slowly and maintain eye contact. C. Use gestures when talking to enhance words. D. Avoid the use of body language when talking to the client. E. Give the client directions using short phrases and simple terms. F. Phrase what was said differently the second time, if there is a need to repeat it. The correct answers are A. Face the client when talking. B. Speak slowly and maintain eye contact. C. Use gestures when talking to enhance words. And E. Give the client directions using short phrases and simple terms. Rationale: a client who is aphasic has difficulty expressing or understanding language. The nurse should face the client when talking, establish and maintain eye contact, and speak slowly and distinctly. The nurse should use gestures and pantomime when talking to enhance words, and use body language to enhance the message. The nurse should give the client directions using short phrases and simple terms and phrase questions so that they can be answered with a yes or no. If there is a need to repeat something, the nurse should use the same words a second time. The client with spinal cord injury is prone to experiencing autonomic dysreflexia. The least appropriate measure to minimize the risk of autonomic dysreflexia is which action? A. Strictly adhering to a bowel retraining program. B. Keeping the linen wrinkle-free under the client. C. Avoiding unnecessary pressure on the lower limbs. D. Limiting bladder catheterization to once every 12 hours. The correct answer is D. Limiting bladder catheterization to once every 12 hours. Rationale: the most frequent cause of autonomic dysreflexia is a distended bladder. Straight catheterization should be performed every 4 to 6 hours, and indwelling bladder catheters should be checked frequently for kinks in the tubing. It is not appropriate to catheterize the client every 12 hours. Constipation and fecal impaction are other causes, so maintaining bowel regularity is important. Other causes include stimulation of the skin from tactile, thermal, or painful stimuli. The nurse administers care to minimize risk in these areas. The nurse has provided discharge instructions to a client with an application of a halo device. The nurse determines that the client needs further teaching if which statement is made. A. I will use a straw for drinking. B. I will drive only during the daytime. C. I will use caution because the device alters balance. D. I will wash the skin daily under the lamb's wool liner of the vest. The correct answer is B. I will drive only during the daytime. Rationale: the client should not drive because the device impairs the range of vision. The halo device alters balance and can cause fatigue because of its weight. The client should cleanse the skin daily under the vest or the device to protect the skin from ulceration, and should use powder or lotion sparingly or not at all. The wool liner should be changed if odor becomes a problem. The client should have food cut into small pieces to facilitate chewing, and use a straw for drinking. Pin care is done as instructed. The nurse notes that the 4-hour postpartum client has cool, clammy skin, and that she is restless and excessively thirsty. The nurse immediately notifies the health care provider and then performs which action? A. Checks the vital signs. B. Begins fundal massage. C. Encourages ambulation. D. Encourages the client to drink fluids. The correct answer is A. Checks the vital signs. Rationale: symptoms of hypovolemia include cool, clammy, and pale skin, feelings of anxiety and restlessness, and thirst. The nurse would check the vital signs. The nurse would not ambulate the client or encourage fluids until specific prescriptions are given to do so. There is no information in the question to indicate the need for fundal massage. The nurse is caring for a postpartum client with a diagnosis of thrombophlebitis. The client suddenly complains of chest pain and dyspnea. The nurse should initially check which item? A. Vital signs. B. Fundal height. C. Presence of calf pain. D. Level of consciousness. The correct answer is A. Vital signs. Rationale: pulmonary embolism is a complication of thrombophlebitis. Changes in the vital signs are one of the first things to occur with pulmonary embolism because pulmonary blood flow is compromised. Fundal height is unrelated to the subject of the question. Calf pain is an indicator of thrombophlebitis. Level of consciousness may change as the condition worsens. Worsening would indicate hypoxia. The nurse is assisting with caring for a client with abruptio placenta. While caring for the client, the nurse notes that the client begins to develop signs of shock. The nurse should take which action first? A. Monitor the urinary output. B. Monitor the maternal pulse. C. Turn the client onto her side. D. Monitor the maternal blood pressure. The correct answer is C. Turn the client onto her side. Rationale: with a pregnant client who is in shock, the nurse would want to increase perfusion to the placenta. A simple way to do this that requires no equipment is to turn the mother on her side. This would increase blood flow to the placenta by relieving pressure from the gravid uterus on the great vessels. The nurse would immediately contact the healthcare provider. The other options would follow quickly.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Emergency surgery is scheduled for a client with a bowel obstruction. The nurse tells the charge nurse that she is unable to obtain informed consent from the client because the client has received opioid analgesics and is sedated. The nurse understands that which action should be implemented. A. Performing the surgery without an informed consent. B. Having the client sign the consent form, because this is an emergency situation. C. Calling the family and telling them that they must come to the hospital to sign the informed consent. D. Obtaining a telephone consent from the family member and ensuring that the oral consent is witnessed by 2 persons. The correct answer is D. Obtaining a telephone consent from the family member and ensuring that the oral consent is witnessed by 2 persons. Rationale: every effort must be made to obtain permission from a responsible family member to perform surgery if the client is unable to sign the consent form. Telephone consent must be witnessed by 2 persons who hear the family member's oral consent. The 2 witnesses then sign the consent and document the name of the family member, noting that an oral consent was obtained. In emergencies, the client may be unable to sign, and family members may not be available. In this type of a situation, the healthcare provider is legally permitted to perform surgery without consent. Consent is not informed if it is obtained from the client, who is confused, unconscious, mentally incompetent, or under the influence of sedatives. A client was involuntarily admitted to the psychiatric unit because of episodes of extremely violent behavior. The client is demanding to be discharged from the hospital. The nurse reports the information to the charge nurse, and the charge nurse does not allow the client to leave. The nurse understands that, which represents the legal ramifications associated with the charge nurse's behavior. A. The charge nurse will be charged with assault. B. The charge nurse will be charged with slander. C. The charge nurse will be charged with imprisonment. D. No charge will be made against the charge nurse because the charge nurse's actions are reasonable. The correct answer is D. No charge will be made against the charge nurse because the charge nurse's actions are reasonable. Rationale: false imprisonment is an act with the intent to confine a person to a specific area. The nurse can be charged with false imprisonment if the nurse prohibits a client from leaving the hospital, if the client was voluntarily admitted, and if there are no agency or legal policies for detaining the client. On the other hand, if the client has been involuntarily admitted, or has agreed to an evaluation before discharge, the nurse's actions are reasonable. The nurse is assisting in reviewing the critical paths of the clients on the nursing unit. In performing a variance analysis, which indicates the need for further action and analysis. A. Clear breath sounds in a client with heart failure. B. A postoperative client who develops a cough and a fever. C. The absence of a wound infection in a client who had a coronary artery bypass graft. D. A client with diabetes mellitus demonstrating accurate use of a glucometer after teaching. The correct answer is B. A postoperative client who develops a cough and a fever. Rationale: variances are actual deviations or detours from the critical paths. Variances can be positive or negative, avoidable or unavoidable, and can be caused by a variety of factors. Positive variance occurs when the client achieves maximum benefit and is discharged earlier than anticipated. Negative variance occurs when untoward events prevent a timely discharge. A postoperative client who develops a cough and a fever identifies a negative outcome. The clinic nurse is collecting data on a client being admitted. The nurse notes that the client is taking azelaic acid. Because of the medication prescription, the nurse should suspect that the client is being treated for which condition? A. Acne. B. Eczema. C. Hair loss. D. Minor bruise. The correct answer is A. Acne. Rationale: azelaic acid is a topical medication used to treat mild to moderate acne. The acid appears to work by suppressing the growth of Propionibacterium acnes and decreasing the proliferation of keratinocytes. Isotretinoin is prescribed for a client with severe acne. Before the administration of this medication, the nurse anticipates that which laboratory test will be prescribed. A. Platelet count. B. Triglyceride level. C. Complete blood count. D. White blood cell count. The correct answer is B. Triglyceride level. Rationale: isotretinoin can elevate triglyceride levels. Blood triglyceride levels should be measured before treatment and periodically thereafter, until the effect on the triglycerides has been evaluated. Options A, C, and D do not need to be monitored specifically during this treatment. Mefenide acetate is prescribed for the client with a burn injury. When applying the medication, the client complains of local discomfort and burning. Which is the most appropriate nursing action? A. Notifying the healthcare provider. B. Discontinuing the medication. C. Informing the client that this is normal. D. Applying a thinner film than prescribed to the burn site. The correct answer is C. Informing the client that this is normal. Rationale: mefenide acetate is bacteriostatic for gram-negative and gram-positive organisms and is used to treat burns to reduce bacteria present in avascular tissues. The client should be informed that the medication will cause local discomfort and burning, and that this is a normal reaction. A client in the cardiac step-down unit requires suctioning for excess mucus secretions. The nurse should be most careful to monitor the client for which dysrhythmia during this procedure. A. Bradycardia. B. Tachycardia. C. Premature ventricular beats. D. Heart block. The correct answer is A. Bradycardia. Rationale: suctioning can cause a vagal response and bradycardia. Answer B is unlikely and, therefore, not most important, although it can occur. Answers C and D can occur as well, but they are less likely. A client has rectal cancer and is scheduled for an abdominal perineal resection. What should be the priority nursing care during the post-op period? A. Teaching how to irrigate the ileostomy. B. Stopping electrolyte loss in the incisional area. C. Encouraging a high-fiber diet. D. Facilitating perineal wound drainage. The correct answer is D. Facilitating perineal wound drainage. Rationale: the client with a perineal resection will have a perineal incision. Drains will be used to facilitate wound drainage. This will help prevent infection of the surgical site. The client will not have an ileostomy, as in answer A. He will have some electrolyte loss, but treatment is not focused on preventing the loss, so answer B is incorrect. A high-fiber diet, in answer C, is not ordered at this time. A client with cancer is admitted to the oncology unit. Stat lab values reveal hemoglobin 12.6, white blood cells 6,500, potassium 1.9, uric acid 7.0, sodium 136, and platelets 178,000. The nurse evaluates that the client is experiencing which of the following? A. Hypernatremia. B. Hypokalemia. C. Myelosuppression. D. Leukocytosis. The correct answer is B. Hypokalemia. Rationale: hypokalemia is evident from the lab values listed. The normal values for potassium is 3.5 to 5.0 milliequivalents per liter. The other laboratory findings are within normal limits, making answers A, C, and D incorrect. The nurse is assisting with caring for a client who has received a transfusion of platelets. The nurse determines that the client is benefiting most from this therapy if the client exhibits which finding? A. An increased hematocrit level. B. An increased hemoglobin level. C. A decline of the temperature to normal. D. A decrease in oozing from puncture sites and gums. The correct answer is D. A decrease in oozing from puncture sites and gums. Rationale: platelets are necessary for proper blood clotting. The client with insufficient platelets may exhibit frank bleeding, or the oozing of blood from puncture sites, wounds, and mucous membranes. The client's temperature would decline to normal after the infusion of granulocytes, if those transfused cells were then instrumental in fighting infection in the body. Increased hemoglobin and hematocrit levels would be seen when the client has received a transfusion of red blood cells. The nurse takes a client's temperature before giving a blood transfusion. The temperature is 100 degrees Fahrenheit orally. What should the nurse do next? A. The transfusion will begin as prescribed. B. Hold the blood and notify the healthcare provider. C. The transfusion will begin after the administration of an antihistamine. D. The transfusion will begin after the administration of 650 milligrams of acetaminophen. The correct answer is B. Hold the blood and notify the healthcare provider. Rationale: if the client has a temperature of 100 degrees Fahrenheit or more, the unit of blood should be held until the healthcare provider is notified and has the opportunity to give further prescriptions. The nurse is assisting with caring for a client who will receive a unit of blood. Just before the infusion, it is most important for the nurse to check which item: A. Vital signs. B. Skin color. C. Oxygen saturation. D. Latest hematocrit level. The correct answer is A. Vital signs. Rationale: a change in the vital signs may indicate that a transfusion reaction is occurring. The nurse assesses the client's vital signs before the procedure to obtain a baseline every 15 minutes for the first half hour after beginning the transfusion and every half hour thereafter. Skin color, oxygen saturation, and most recent hematocrit may be checked but are not the most important. A client who is receiving a blood transfusion rings the call bell for the nurse. When entering the room, the nurse notes that the client is flushed, dyspneic, and complaining of generalized itching. How should the nurse correctly interpret these findings? A. Bacteremia. B. Fluid overload. C. Hypovolemic shock. D. Transfusion reaction. The correct answer is D. Transfusion reaction. Rationale: the signs and symptoms exhibited by the client are consistent with a transfusion reaction. With bacteremia, the client would have a fever, which is not part of the clinical picture presented. With fluid overload, the client would have crackles in addition to dyspnea. There is no correlation between the signs mentioned in the question and hypovolemic shock. The signs identified in the question are indicative of an allergic reaction, which is one type of blood transfusion reaction. A client has passed away, and the wife of the client tells the nurse that the client is an organ donor and that his eyes are to be donated. Which action should the nurse take next? A. Place dry, sterile dressings over the eyes of the deceased. B. Call the National Donor Association to confirm that the client is a donor. C. Close the eyes, elevate the head of the bed, and place a small ice pack on the eyes. D. Ask the wife to obtain the legal documents regarding organ donation from the lawyer. The correct answer is C. Close the eyes, elevate the head of the bed, and place a small ice pack on the eyes. Rationale: when a corneal donor dies, antibiotic eye drops may be prescribed and instilled. The eyes are closed and a small ice pack is placed on the closed eyes. The head of the bed is raised to 30 degrees to prevent edema. Within 2 to 4 hours, the eyes are enucleated. The cornea is usually transplanted within 24 to 48 hours. Option 1 is incorrect because dry dressings are not applied. Some organ donation protocols indicate using normal saline moistened gauze. Option 2 is not an immediate action. In addition, the client should have a signed donor card, living will, or an organ donor identified driver's license, stating his or her wishes. Additional legal documentation should not be required. Agency procedures regarding donor care should be followed. The nurse has delegated several nursing tasks to staff members. Which is the nurse's primary responsibility after the delegation of the tasks? A. Document that the task was completed. B. Assign the tasks that were not completed to the next nursing shift. C. Allow each staff member to make judgments when performing the tasks. D. Perform follow-up with each staff member regarding the performance and outcome of the task. The correct answer is D. Perform follow-up with each staff member regarding the performance and outcome of the task. Rationale: the ultimate responsibility for a task lies with the person who delegated it. Therefore, it is the nurse's primary responsibility to follow up with each staff member regarding the performance of the task and the outcomes related to implementing the task. Not all staff members have the education, knowledge, and ability to make judgments about tasks being performed. The nurse documents that the task has been completed, but this would not be done until follow-up was implemented and outcomes were identified. It is not appropriate to assign the tasks that were not completed to the next nursing shift.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse employed in an emergency department is assigned to assist with the triage of clients arriving to the emergency department. The nurse should assign priority to which client? A. A client complaining of muscle aches, a headache, and malaise. B. A client who twisted her ankle when she fell while inline skating. C. A client with a minor laceration on the index finger, sustained while cutting an eggplant. D. A client with chest pain, who states that he just ate pizza that was made with a very spicy sauce. The correct answer is D. A client with chest pain, who states that he just ate pizza that was made with a very spicy sauce. Rationale: in an emergency department, triage involves classifying clients according to their need for care, and it includes establishing priorities of care. The type of illness, the severity of the problem, and the resources available govern the process. Clients with trauma, chest pain, severe respiratory distress, cardiac arrest, limb amputation, or acute neurological deficits, and those who sustained a chemical splash to the eyes, are classified as emergent, and these clients are the number one priority. The nurse is assigned to care for clients. When planning client rounds, which client should the nurse check first? A. A client on a ventilator. B. A client in skeletal traction. C. A postoperative client preparing for discharge. D. A client admitted on the previous shift, who has a diagnosis of gastroenteritis. The correct answer is A. A client on a ventilator. Rationale: the airway is always a priority, so the nurse first checks the client on a ventilator. The clients described in options B, C, and D have needs that would be identified as intermediate priorities. A client complaining of not feeling well is seen in a clinic. The client is taking several medications for the control of heart disease and hypertension. These medications include a beta blocker, digoxin, and a diuretic. A tentative diagnosis of digoxin toxicity is made. Which assessment data supports this diagnosis? A. Dyspnea, edema, and palpitations. B. Chest pain, hypotension, and paresthesia. C. Double vision, loss of appetite, and nausea. D. Constipation, dry mouth, and sleep disorder. The correct answer is C. Double vision, loss of appetite, and nausea. Rationale: double vision, loss of appetite, and nausea are signs of digoxin toxicity. Additional signs of digoxin toxicity include bradycardia, difficulty reading, visual alterations such as green, and yellow vision, or seeing spots or halos, confusion, vomiting, diarrhea, decreased libido, and impotence. The nurse is caring for a client who has been prescribed furosemide and is monitoring for adverse effects associated with this medication. Which should the nurse recognize as potential adverse effects? Select all that apply. A. Nausea. B. Tinnitus. C. Hypotension. D. Hypokalemia. E. Photosensitivity. F. Increased urinary frequency. The correct answers are B. Tinnitus, C. Hypotension, and D. Hypokalemia. Rationale: furosemide is a loop diuretic, therefore, an expected effect is increased urinary frequency. Nausea is a frequent side effect, not an adverse effect. Photosensitivity is an occasional side effect. Adverse effects include tinnitus, hypotension, and hypokalemia. The nurse is preparing to administer digoxin, 0.125 mg orally, to a client with heart failure. Which vital sign is most important for the nurse to check before administering the medication? A. Heart rate. B. Temperature. C. Respirations. D. Blood pressure. The correct answer is A. Heart rate. Rationale: digoxin is a cardiac glycoside that is used to treat heart failure and acts by increasing the force of myocardial contraction. Because bradycardia may be a clinical sign of toxicity, the nurse counts the apical heart rate for 1 full minute before administering the medication. If the pulse rate is less than 60 beats per minute in an adult client, the nurse would withhold the medication and contact the healthcare provider. The nurse is planning to administer amlodipine to a client. The nurse should plan to check which before giving the medication? A. Respiratory rate. B. Blood pressure and heart rate. C. Heart rate and respiratory rate. D. Level of consciousness and blood pressure. The correct answer is B. Blood pressure and heart rate. Rationale: amlodipine is a calcium channel blocker. This medication decreases the rate and force of cardiac contraction. Before administering a calcium channel blocking agent, the nurse should check the blood pressure and heart rate, which could both decrease, in response to the action of this medication. This action will help to prevent or identify early problems related to decreased cardiac contractility, heart rate, and conduction. The nurse reviews the results of a tuberculin skin test performed on a 3-year-old child. The results indicate an area of induration that measures 10 millimeters. How should the nurse interpret this result? A. Positive. B. Negative. C. Inconclusive. D. Definitive, requiring a repeat test. The correct answer is A. Positive. Rationale: an induration that measures 10 millimeters or more is considered to be a positive result for children who are younger than 4 years old, and for those with chronic illness, or with a high risk for environmental exposure to tuberculosis. A reaction of 5 millimeters or more is considered to be a positive result for those in the highest risk groups. The nurse is caring for a hospitalized infant with bronchiolitis. Diagnostic tests have confirmed respiratory syncytial virus. On the basis of this finding, which should be the appropriate nursing action? A. Initiate strict enteric precautions. B. Wear a mask when caring for the child. C. Plan to move the infant to a room with another child with RSV. D. Leave the infant in the present room because RSV is not contagious. The correct answer is C. Plan to move the infant to a room with another child with RSV. Rationale: RSV is a highly communicable disorder, but it is not transmitted via the airborne route. It is usually transferred by the hands, and meticulous hand washing is necessary to decrease the spread of organisms. The infant with RSV is isolated in a single room, or placed in a room with another child with RSV. Enteric precautions are not necessary, however, the nurse should wear a gown when the soiling of clothing may occur. After a tonsillectomy, which fluid or food item would be appropriate to offer to the child? A. Yellow Jell-O. B. Cold ginger ale. C. Vanilla pudding. D. Cherry popsicle. The correct answer is A. Yellow Jell-O. Rationale: after a tonsillectomy, clear, cool liquids should be administered. Citrus, carbonated, and extremely hot or cold liquids need to be avoided because they may irritate the throat. Milk and milk products are avoided because they coat the throat and cause the child to clear the throat, thus increasing the risk of bleeding. Red liquids need to be avoided because they give the appearance of blood if the child vomits. The nurse reinforces instructions to the mother of a child who has been hospitalized with croup. Which statement made by the mother would indicate the need for further teaching? A. I will give my child cough syrup if a cough develops. B. During an attack, I will take my child to a cool location. C. I can give acetaminophen if my child develops a fever. D. I will be sure that my child drinks at least 3 to 4 glasses of fluids every day. The correct answer is A. I will give my child cough syrup if a cough develops. Rationale: cough syrups and cold medicines are not to be given because they may dry and thicken secretions. During a croup attack, the child can be taken to a cool basement or garage. Acetaminophen is used if a fever develops. Adequate hydration of 500 to 1,000 milliliters of fluids daily is important for thinning secretions. After a tonsillectomy, the child begins to vomit bright red blood. Which is the initial nursing action? A. Turn the child to the side. B. Notify the health care provider. C. Administer the prescribed antiemetic. D. Maintain nothing by mouth status. The correct answer is A. Turn the child to the side. Rationale: after a tonsillectomy, if bleeding occurs, the child is turned to the side and then the HCP is notified. An NPO status would be maintained and an antiemetic may be prescribed. However, the initial nursing action would be to turn the child to the side. The nurse is caring for a client after enucleation and notes the presence of bright red drainage on the dressing. The nurse should take which appropriate action? A. Document the finding. B. Continue to monitor vital signs. C. Report the finding to the healthcare provider. D. Mark the drainage on the dressing and monitors for any increase in bleeding. The correct answer is C. Report the finding to the healthcare provider. Rationale: if the nurse notes the presence of bright red drainage on the dressing, it must be reported to the healthcare provider because this can indicate hemorrhage. Options A, B, and D will delay necessary treatment. A client sustains a contusion of the eyeball after a traumatic injury with a blunt object. The nurse should take which immediate action? A. Notify the healthcare provider. B. Apply ice to the affected eye. C. Irrigate the eye with cool water. D. Accompany the client to the emergency department. The correct answer is B. Apply ice to the affected eye. Rationale: treatment for a contusion begins at the time of injury. Ice is applied immediately. The client should receive a thorough eye examination to rule out the presence of other eye injuries. Eye irrigation is not indicated in a contusion. Options A and D will delay immediate treatment. After the application of ice, the HCP would be notified. A client arrives in the emergency department after an automobile crash. The client's forehead hit the steering wheel, and a high FEMA has been diagnosed. Which position should the nurse prepare to position the client? A. Flat on bed rest. B. On bed rest in a semi-Fowler's position. C. In lateral position on the unaffected side. D. In the lateral position on the affected side. The correct answer is B. On bed rest in a semi-Fowler's position. Rationale: a high FEMA is the presence of blood in the anterior chamber. It is produced when a force is sufficient to break the integrity of the blood vessels in the eye. It can be caused by direct injury, such as penetrating injury from a BB pellet, or indirectly, such as from striking the forehead on a steering wheel during an accident. The client is treated by bed rest, in a semi-Fowler's position, to assist gravity in keeping the hyphema away from the optical center of the cornea. The nurse is assisting in developing a teaching plan for the client with glaucoma. Which instruction should the nurse suggest to include in the plan of care? A. Decrease the amount of salt in the diet. B. Decrease fluid intake to control the intraocular pressure. C. Avoid reading the newspaper and watching television. D. Eye medications will need to be administered for the rest of your life. The correct answer is D. Eye medications will need to be administered for the rest of your life. Rationale: the administration of eye drops is a critical component of the treatment plan for the client with glaucoma. The client needs to be instructed that medications will need to be taken for the rest of his or her life. Limiting fluids and reducing salt will not decrease intraocular pressure. Option C is not necessary.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is reinforcing home care instructions to a client and family regarding care after cataract removal from the right eye. Which statement made by the client indicates an understanding of the instructions? A. I should not sleep on my left side. B. I should not sleep on my right side. C. I will take aspirin if I have any pain. D. I should not wear my glasses until my surgeon says it is okay. The correct answer is B. I should not sleep on my right side. Rationale: after cataract surgery, the client should not sleep on the side of the body that was operated on. Clients should be instructed not to take aspirin or any medications that contain aspirin because of their antiplatelet properties that can increase the risk of bleeding. Acetaminophen can be taken as needed for pain. Clients may wear their glasses. The nurse is reinforcing instructions to a hospitalized client with a diagnosis of emphysema about positions that will enhance the effectiveness of breathing during dyspneic episodes. Which position should the nurse instruct the client to assume? A. Side lying in bed. B. Sitting in a recliner chair. C. Sitting up in bed at a 90-degree angle. D. Sitting on the side of the bed, leaning on an overbed table. The correct answer is D. Sitting on the side of the bed, leaning on an overbed table. Rationale: positions that will assist the client with breathing include sitting up and leaning on an overbed table, sitting up and resting with the elbows on the knees, or standing or leaning against the wall. The nurse is assigned to care for a client who has a chest tube. The nurse is told to monitor the client for crepitus. Which method should be used to monitor the client for crepitus? A. Asking the client about pain. B. Checking the respirations hourly. C. Checking the blood pressure every 2 hours. D. Palpating for the leakage of air into the subcutaneous tissues. The correct answer is D. Palpating for the leakage of air into the subcutaneous tissues. Rationale: subcutaneous emphysema is also known as crepitus. It presents as a puffed-up appearance that is caused by the leakage of air into the subcutaneous tissues. It is monitored by palpating, and it feels like bubble wrap when palpated. Although options 1, 2, and 3 may be components of the plan of care for a client with a chest tube, these actions will not identify subcutaneous emphysema. The nurse is assisting in planning care for a client with a chest tube. The nurse should suggest to include which interventions in the plan. Select all that apply. A. Pin the tubing to the bed linens. B. Be sure all connections remain airtight. C. Be sure all connections are taped and secure. D. Empty the drainage from the drainage collection chamber daily. E. Monitor closely for tubing that is kinked or obstructed by the weight of the client. The correct answers are B. Be sure all connections remain airtight. C. Be sure all connections are taped and secure. and E. Monitor closely for tubing that is kinked or obstructed by the weight of the client. Rationale: chest tube tubing is never pinned to the bed linens, because this presents the risk of accidental dislodgement of the tube when the client moves. The chest tube system is not opened and emptied because a closed system must be maintained. If the system is opened, lung collapse can occur. The nurse is assisting with monitoring the functioning of a chest tube drainage system in a client who just returned from the recovery room after a thoracotomy with wedge resection. Which findings should the nurse expect to note? Select all that apply. A. Excessive bubbling in the water seal chamber. B. Vigorous bubbling in the suction control chamber. C. 50 milliliters of drainage in the drainage collection chamber. D. The drainage system is maintained below the client's chest. E. An occlusive dressing is in place over the chest tube insertion site. F. Fluctuation of water in the tube of the water seal chamber during inhalation and exhalation. The correct answers are C. 50 milliliters of drainage in the drainage collection chamber. D. The drainage system is maintained below the client's chest. E. An occlusive dressing is in place over the chest tube insertion site. And F. Fluctuation of water in the tube of the water seal chamber during inhalation and exhalation. Rationale: the bubbling of water in the water seal chamber indicates air drainage from the client. This is usually seen when intrathoracic pressure is greater than atmospheric pressure, and it may occur during exhalation, coughing, or sneezing. Excessive bubbling in the water seal chamber may indicate an air leak, which is an unexpected finding. The fluctuation of water in the tube in the water seal chamber during inhalation and exhalation is expected. An absence of fluctuation may indicate that the chest tube is obstructed, the lung has re-expanded, or no more air is leaking into the pleural space. A client is being prepared for a thoracentesis. The nurse should assist the client to which position for the procedure? A. Sims position, with the head of the bed flat. B. Prone, with the head turned to the side, supported by a pillow. C. Lying in bed on the affected side, with the head of the bed elevated 45 degrees. D. Lying in bed on the unaffected side, with the head of the bed elevated 45 degrees. The correct answer is D. Lying in bed on the unaffected side, with the head of the bed elevated 45 degrees. Rationale: to facilitate the removal of fluid from the chest, the client is positioned sitting on the edge of the bed, leaning over a bedside table, with the feet supported on a stool, or lying in bed on the unaffected side, with the head of the bed elevated 45 degrees. A pregnant client asks the nurse in the clinic when she will be able to start feeling the fetus move. The nurse responds by telling the mother that fetal movements will be noted between which weeks of gestation? A. Between 6 and 8 weeks gestation. B. Between 8 and 10 weeks gestation. C. Between 10 and 12 weeks gestation. D. Between 16 and 20 weeks gestation. The correct answer is D. Between 16 and 20 weeks gestation. Rationale: quickening is fetal movement that usually first occurs between 16 and 20 weeks gestation. The expectant mother first notices subtle fetal movements during this time, and these gradually increase in intensity. Options A, B, and C are incorrect. These gestational time frames are too early for quickening. During a prenatal visit, the nurse checks the fetal heart rate of a client in the third trimester of pregnancy. The nurse determines that the FHR is normal if which heart rate is noted? A. 80 beats per minute. B. 100 beats per minute. C. 150 beats per minute. D. 180 beats per minute. The correct answer is C. 150 beats per minute. Rationale: fetal heart rate depends on gestational age. It is normally 160 to 170 beats per minute during the first trimester, but it slows with fetal growth to 110 to 160 beats per minute, near or at term. The nurse reviews the arterial blood gas results of a client and notes that the results indicate a pH of 7.30, PCO2 of 52 mm of mercury, and HCO3 of 22 milliequivalents per liter. Which interpretation does the nurse correctly make about these results? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. The correct answer is C. Respiratory acidosis. Rationale: normal pH is 7.35 to 7.45. In a respiratory condition, an opposite effect will be seen between the pH and the PCO2. In this situation, the pH is low, and the PCO2 is increased. In an acidotic condition, the pH is decreased. Therefore, the values identified in the question indicate a respiratory acidosis. The nurse is caring for a client with respiratory insufficiency. The arterial blood gas results indicate a pH of 7.50 and a PCO2 of 30 mm of mercury, and the nurse is told that the client is experiencing respiratory alkalosis. Which additional laboratory value should the nurse expect to note? A. A sodium level of 145 milliequivalents per liter. B. A potassium level of 3.2 milliequivalents per liter. C. A magnesium level of 2.4 mg per deciliter. D. A phosphorus level of 4.0 mg per deciliter. The correct answer is B. A potassium level of 3.2 milliequivalents per liter. Rationale: signs/symptoms of respiratory alkalosis include tachypnea, mental status changes, dizziness, pallor around the mouth, spasms of the muscles of the hands, and hypokalemia. The remaining options identify normal laboratory results. The nurse is caring for a client with a diagnosis of chronic obstructive pulmonary disease. The nurse should monitor the client for which acid-base imbalance? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. The correct answer is C. Respiratory acidosis. Rationale: respiratory acidosis most often occurs as a result of primary defects in the function of the lungs or changes in normal respiratory patterns from secondary problems. Chronic respiratory acidosis is most commonly caused by COPD. Acute respiratory acidosis also occurs in clients with COPD when superimposed respiratory infection or concurrent respiratory disease increases the work of breathing. The remaining options are not likely to occur unless other conditions complicate the COPD. The nurse is caring for a client with severe diarrhea. The nurse monitors the client closely, understanding that this client is at risk for developing which acid-base disorder? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. The correct answer is A. Metabolic acidosis. Rationale: intestinal secretions high in bicarbonate may be lost through enteric drainage tubes, and ileostomy, or diarrhea. The decreased bicarbonate level creates the actual base deficit of metabolic acidosis. The remaining options are unlikely to occur in a client with severe diarrhea. The nurse is told that the blood gas results indicate a pH of 7.50 and a PCO2 of 32 mm of mercury. The nurse determines that these results are indicative of which acid-base disturbance? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. The correct answer is D. Respiratory alkalosis. Rationale: the normal pH is 7.35 to 7.45. In a respiratory condition, an opposite relationship will be seen between the pH and the PCO2, as is seen in the correct option. In an alkalotic condition, the pH is increased. In an acidotic condition, the pH is decreased, so both metabolic acidosis and respiratory acidosis can be eliminated. Metabolic alkalosis can also be eliminated because both pH and HCO3 are increased above normal values in this condition. After kidney transplantation, cyclosporin is prescribed for a client. Which laboratory result would indicate an adverse effect from the use of this medication? A. Decreased creatinine level. B. Decreased hemoglobin level. C. Elevated white blood cell count. D. Elevated blood urea nitrogen level. The correct answer is D. Elevated blood urea nitrogen level. Rationale: nephrotoxicity can occur from the use of cyclosporin. Nephrotoxicity is evaluated by monitoring for elevated blood urea nitrogen and serum creatinine levels. Cyclosporin does not depress the bone marrow. The nurse who is administering bethanetol chloride is monitoring for acute toxicity associated with the medication. The nurse should check the client for which sign of toxicity? A. Dry skin. B. Dry mouth. C. Bradycardia. D. Signs of dehydration. The correct answer is C. Bradycardia. Rationale: toxicity produces manifestations of excessive muscarinic stimulation, such as salivation, sweating, involuntary urination, and defecation, bradycardia, and severe hypotension. Treatment includes supportive measures and the administration of atropine sulfate subcutaneously or intravenously.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Trimethoprim sulfamethoxazole is prescribed for a client. The nurse should instruct the client to report which symptom, if it is developed during the course of this medication therapy. A. Nausea. B. Diarrhea. C. Headache. D. Sore throat. The correct answer is D. Sore throat. Rationale: clients taking trimethoprim sulfamethoxazole should be informed about early signs of blood disorders that can occur from this medication. These include sore throat, fever, and pallor. The client should be instructed to notify the healthcare provider if these symptoms occur. The other options do not require HCP notification. A sulfonamide is prescribed for a client with a urinary tract infection. On review of the client's record, the nurse notes that the client is taking warfarin sodium daily. Which prescription should the nurse anticipate for this client? A. Discontinuation of warfarin sodium. B. A decrease in the warfarin sodium dosage. C. An increase in the warfarin sodium dosage. D. A decrease in the usual dose of sulfonamide. The correct answer is B. A decrease in the warfarin sodium dosage. Rationale: sulfonamides can potentiate the effects of warfarin sodium, phenytoin, and orally administered hypoglycemics, such as tolbutamide. When an oral anticoagulant is combined with a sulfonamide, a decrease in the anticoagulant dosage may be needed. The nurse is reinforcing discharge instructions to a client receiving baclofen. Which should the nurse include in the instructions? A. Restrict fluid intake. B. Avoid the use of alcohol. C. Stop the medication if diarrhea occurs. D. Notify the healthcare provider if fatigue occurs. The correct answer is B. Avoid the use of alcohol. Rationale: baclofen is a central nervous system depressant. The client should be cautioned against the use of alcohol and other central nervous system depressants because baclofen potentiates the depressant activity of these agents. It is not necessary to restrict fluids, but the client should be warned that urinary retention can occur. Constipation rather than diarrhea is an adverse effect of baclofen. Fatigue is related to a CNS effect that is most intense during the early phase of therapy and diminishes with continued medication use. It is not necessary that the client notify the healthcare provider if fatigue occurs. Cyclobenzaprine is prescribed for a client to treat muscle spasms, and the nurse is reviewing the client's record. Which disorder would indicate a need to contact the healthcare provider regarding the administration of this medication? A. Glaucoma. B. Emphysema. C. Hyperthyroidism. D. Diabetes mellitus. The correct answer is A. Glaucoma. Rationale: because this medication has anticholinergic effects, it should be used with caution in clients with a history of urinary retention, angle closure glaucoma, and increased intraocular pressure. Cyclobenzaprine hydrochloride should be used only for short-term, such as a 2 to 3 weeks therapy. The disorders in options B, C, and D are not a concern when the client is taking cyclobenzaprine. The nurse is reviewing the laboratory studies on a client receiving dantrolene sodium. Which laboratory test would identify an adverse effect associated with the administration of this medication? A. Creatinine. B. Liver function tests. C. Blood urea nitrogen. D. Hematological function tests. The correct answer is B. Liver function tests. Rationale: dose-related liver damage is the most serious adverse effect of dantrolene. To reduce the risk of liver damage, liver function tests should be performed before treatment and periodically throughout the treatment course. It is administered in the lowest effective dosage for the shortest time necessary. Options A and C are tests that assess kidney function. In monitoring a client's response to disease-modifying anti-rheumatic drugs, which findings should the nurse interpret as acceptable responses? Select all that apply. A. Symptom control during periods of emotional stress. B. Normal white blood cell, platelet, and neutrophil counts. C. Radiological findings that show non-progression of joint degeneration. D. An increased range of motion in the affected joints 3 months into therapy. E. Inflammation and irritation at the injection site 3 days after injection is given. F. A low-grade temperature upon rising in the morning that remains throughout the day. The correct answers are A. Symptom control during periods of emotional stress, B. Normal white blood cell, platelet, and neutrophil counts, C. Radiological findings that show non-progression of joint degeneration, and D. An increased range of motion in the affected joints 3 months into therapy. Rationale: because emotional stress frequently exacerbates the symptoms of rheumatoid arthritis, the absence of symptoms is a positive finding. Disease-modifying anti-rheumatic drugs are given to slow progression of joint degeneration. In addition, the improvement in the range of motion after 3 months of therapy with normal blood work is a positive finding. Temperature elevation and inflammation and irritation at the medication injection site could indicate signs of infection. Alendronate is prescribed for a client with osteoporosis, and the nurse is providing instructions on administration of the medication. Which instruction should the nurse reinforce? A. Take the medication at bedtime. B. Take the medication in the morning with breakfast. C. Lie down for 30 minutes after taking the medication. D. Take the medication with a full glass of water after rising in the morning. The correct answer is D. Take the medication with a full glass of water after rising in the morning. Rationale: precautions need to be taken with the administration of alendronate to prevent gastrointestinal side/adverse effects and to increase absorption of the medication. The medication needs to be taken with a full glass of water after rising in the morning. The client should not eat or drink anything for 30 minutes following administration and should not lie down after taking the medication. A client with sickle cell disease has been admitted to the hospital, complaining of a sudden onset of severe pain in the extremities, abdomen, back, and chest. In which priority order should the nurse perform the actions listed? Arrange the actions in the order they should be performed. All options must be used. A. Administer an opioid analgesic. B. Hydrate the client with normal saline 0.9%. C. Administer oxygen. D. Keep room temperature at or above 72 degrees. E. Encourage the client to keep extremities extended. The correct order is C. Administer oxygen. A. Administer an opioid analgesic. B. Hydrate the client with normal saline 0.9%. E. Encourage the client to keep extremities extended, and then D. Keep room temperature at or above 72 degrees. Rationale: a client in a sickle cell crisis will have pain as the body's tissues become hypoxic. Oxygenation is important, so oxygen is applied first. To decrease the pain from the sickling process, the client is given an opioid analgesic. The client is then started on an isotonic solution to help prevent further sickling. Keeping the extremities extended and not bent decreases sickling risk, as does keeping the room warm. A client has experienced several episodes of sickle cell crisis. Which reinforced instruction should be included in the client's teaching plan to prevent recurrence? A. Vigorous exercise is encouraged to maintain cardiovascular function. B. Iced liquids will combat dehydration and should be consumed regularly. C. Wear shoes and socks when walking outside to prevent damage to the feet. D. To prevent opioid tolerance, avoid taking pain medication at the beginning of the crisis. The correct answer is C. Wear shoes and socks when walking outside to prevent damage to the feet. Rationale: wearing socks and shoes will prevent wounds to the legs and feet, which heal slowly and frequently become infected in clients with sickle cell disease. Vigorous exercise and iced liquids can precipitate a crisis and should be avoided. Opioid tolerance is not a priority or immediate concern for clients experiencing a sickle cell crisis. These clients experience a great deal of pain and require opioids for pain relief. The nurse is instructing a client on how to decrease the intake of calcium in the diet. The nurse should tell the client that which food item is least likely to contain calcium. A. Milk. B. Butter. C. Spinach. D. Collard greens. The correct answer is B. Butter. Rationale: butter comes from milk fat and does not contain significant amounts of calcium. Milk, spinach, and collard greens are calcium-containing foods and should be avoided by the client on a calcium-restricted diet. The nurse is caring for a client with a diagnosis of hyperparathyroidism. Laboratory studies are performed, and the serum calcium level is 12.0 mg per deciliter. Based on this laboratory value, the nurse should take which action? A. Document the value in the client's record. B. Inform the doctor of the laboratory value. C. Place the laboratory result form in the client's record. D. Reassure the client that the laboratory result is normal. The correct answer is B. Inform the doctor of the laboratory value. Rationale: the normal serum calcium level ranges from 8.6 to 10.0 mg per deciliter. The client is experiencing hypercalcemia, and the nurse would inform the doctor of the laboratory value. Because the client is experiencing hypercalcemia, the remaining options are incorrect actions. The nurse reviews electrolyte values and notes a sodium level of 130 milliequivalents per liter. The nurse expects that this sodium level would be noted in a client with which condition? A. The client with watery diarrhea. B. The client with diabetes insipidus. C. The client with an inadequate daily water intake. D. The client with the syndrome of inappropriate secretion of antidiuretic hormone. The correct answer is D. The client with the syndrome of inappropriate secretion of antidiuretic hormone. Rationale: hyponatremia is a serum sodium level less than 135 milliequivalents per liter. Hyponatremia can occur secondary to syndrome of inappropriate antidiuretic hormone secretion. The client with an inadequate daily water intake, watery diarrhea, or diabetes insipidus is at risk for hypernatremia. What are the steps in order of priority for application of an ostomy appliance? Arrange the actions in the order they should be performed. All options must be used. 1. Assess the stoma and skin. 2. Remove the used pouch and barrier. 3. Perform hand hygiene and don gloves. 4. Cleanse the peristomal area with warm water. 5. Press the adhesive backing of the pouch against the skin. 6. Cut the opening on the appliance 1/16 inch larger than the stoma. The correct order is 3. Perform hand hygiene and don gloves. 2. Remove the used pouch and barrier. 4. Cleanse the peristomal area with warm water. 1. Assess the stoma and skin. 6. Cut the opening on the appliance 1/16 inch larger than the stoma. And 5. Press the adhesive backing of the pouch against the skin. Rationale: the nurse would wash the hands and don gloves before removing the pouch and barrier. The peristomal area is cleansed with warm water to remove residue and improve visualization. The stoma is assessed for color and the skin is checked for irritation. The appliance is measured and cut 1/16 inch larger than the stoma to prevent strangulation of the stoma or too much room for skin irritation between the stoma and appliance. The adhesive backing of the appliance is pressed against the skin, avoiding wrinkles to achieve seal. A 7-year-old child is admitted to the pediatric unit with acute exacerbation of asthma due to infection. The healthcare provider has written the following prescriptions. In which priority order should the nurse implement the prescriptions? Arrange the actions in the order that they should be performed. All options must be used. 1. Clear liquids PO as tolerated. 2. High Fowler's position. 3. Chest X-ray. 4. Erythromycin ethylsuccinate 200 mg orally every 6 hours. 5. O2 via nasal cannula at 2 liters per minute. The correct order is 2. High Fowler's position. 5. O2 via nasal cannula at 2 liters per minute. 4. Erythromycin ethylsuccinate 200 mg orally every 6 hours. 3. Chest X-ray. And 1. Clear liquids PO as tolerated. Rationale: placing the child in High Fowler's position first will assist in breathing. The oxygen can then be applied. Administering the antibiotic is the next priority. The chest X-ray should not be done until the child has had oxygen and the first dose of the antibiotic. The clear liquid diet is the last task to be performed. The nursing student is asked to describe the correct steps for performing adult cardiopulmonary resuscitation. Arrange the actions in the order that they should be performed. All options must be used. 1. Initiate breathing. 2. Open the client's airway. 3. Perform chest compressions. 4. Determine unconsciousness by shaking the client and asking, "Are you okay?" The correct order is 4. Determine unconsciousness by shaking the client and asking, "Are you okay?" 3. Perform chest compressions. 2. Open the client's airway. And 1. Initiate breathing. Rationale: the sequence for basic CPR for healthcare providers follows CAB, compressions, airway, and breathing. After determining unconsciousness, compressions are started.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The medication prescribed is heparin sodium, 650 units subcutaneously, every 12 hours. The medication vial reads heparin sodium, 1,000 units per 1 milliliter. The nurse prepares how many milliliters to administer one dose? A. 6.50 milliliters. B. 0.65 milliliters. C. 650 milliliters. D. 6,500 milliliters. The correct answer is B. 0.65 milliliters. Rationale: the formula for this question is desired times quantity over on hand equals to milliliter per dose. So in this question, desired is 650 units, quantity is 1 milliliter, on hand is 1,000 units. You plug these numbers into the formula, so 650 units times 1 milliliter over 1,000 units equals to 0.65 milliliters. The intravenous prescription is 1,000 milliliters of 0.9% sodium chloride to run over 12 hours. The drop factor is 15 drops per 1 milliliter. The nurse plans to adjust the flow rate to how many drops per minute? Round the answer to the nearest whole number. A. 18 drops per minute. B. 19 drops per minute. C. 20 drops per minute. D. 21 drops per minute. The correct answer is D. 21 drops per minute. Rationale: the prescribed 1000 milliliters is to be infused over 12 hours. Follow the formula and multiply 1000 milliliters by 15. Then divide the result by 720 minutes. The infusion is to run at 20.8 or 21 drops per minute. The nurse is monitoring a preterm labor client who is receiving magnesium sulfate intravenously. The nurse should monitor for which adverse effects of this medication. Select all that apply. A. Flushing. B. Hypertension. C. Increased urine output. D. Depressed respirations. E. Extreme muscle weakness. F. Hyperactive deep tendon reflexes. The correct answers are A. Flushing, D. Depressed respirations, and E. Extreme muscle weakness. Rationale: magnesium sulfate is a central nervous system depressant, and it relaxes smooth muscle, including the uterus. It is used to stop preterm labor contractions, and it is used for preeclamptic clients to prevent seizures. Adverse effects include flushing, depressed respirations, depressed deep tendon reflexes, hypotension, extreme muscle weakness, decreased urine output, pulmonary edema, and elevated serum magnesium levels. The nurse is assisting with planning care for a client with an internal radiation implant, which should be included in the plan of care. Select all that apply. A. Wearing gloves when emptying the client's bedpan. B. Keeping all linens in the room until the implant is removed. C. Wearing a film badge when in the client's room. D. Wearing a lead apron when providing direct care to the client. E. Placing the client in a semi-private room at the end of the hallway. The correct answers are A. Wearing gloves when emptying the client's bedpan. B. Keeping all linens in the room until the implant is removed. C. Wearing a film badge when in the client's room. And D. Wearing a lead apron when providing direct care to the client. Rationale: a private room with a private bath is essential if a client has an internal radiation implant. This is necessary to prevent the accidental exposure of other clients to radiation. The remaining options identify interventions that are necessary for a client with a radiation device. The nurse is assisting with caring for a client after a craniotomy. Which is the best position for the client to be placed? A. Prone position. B. Supine position. C. Semi-Fowler's position. D. Dorsal recumbent position. The correct answer is C. Semi-Fowler's position. Rationale: after a craniotomy, the head of the bed is elevated 30 to 45 degrees, and the client's head is maintained in a midline, neutral position to facilitate venous drainage. Options A, B, and D are incorrect positions.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.